So when kids don't have stressful experiences, they don't recognize those feelings and sensations and thoughts that come through. And, parents are so well intending, Cynthia. They really want their kids to have the best. When we teach kids, hey, listen, that's what grief feels like. Hey, that's what depression, sadness feels like. They're able to recognize it, process, and address it instead of being overwhelmed by it because they've never experienced it. There's so many parts about experiencing failure. A pill is not going to fix things. And the basis of my work is regulating the nervous system, coming in with new learning, because it's about teaching you another way to cope.
There's something that you brought to my attention earlier today that I wanted to share with listeners. And for many parents, obviously, I have a 16-year-old and an 18-year-old. You have a tween and a teen.
No, they're both teenagers now,
They're
Cynthia.
both teenagers.
13 and 18.
Oh, so you understand. You've got two teenagers yourself. For me, thinking about the impact of the pandemic on my children, and not just my children, but everyone's children. And the article that you shared with me was specific to what brain scans have revealed during the pandemic, the impact on teenagers' mental health. And I'm going to kind of synopsize this and I'll let you kind of address it because obviously you are in the thick of it. You see the net impact on your patients. It's saying the adolescent brain is still developing and vulnerable to external and internal factors. This is Elizabeth Powell, who's the program officer of the National Institute on Alcohol Abuse and Alcoholism. The abstracts in this group show that major stressors in teenage lives, including those associated with the pandemic and mood disorders, may have significant effects on the way their brains are structured and organized, with potential implications for their mental health. And I want to just tie into the fact, and we'll talk about what specifically they found, but it's not just your children, my children, it's every listener here that is part of the everyday wellness community probably has a very unique perspective on the net impact of what that time period of everything kind of getting very quiet and families being home together. And especially with, what I would describe, my kids were a teen and a tween, but for them, the net impact of not being able to socialize with their friends, not being able to be around their friends, I think has had a significant and large impact on their emotional and mental growth. And so for you as a mental health specialist, clinical psychologist, what have been some of the broad-based changes that you saw in your patient population during and after the pandemic?
Well, we'll talk a little bit about this study too, but I think what I have seen in general, and I think that, I know this is going on across the globe, is there has just been a real increase in mental health issues in general, but also I feel like mental health issues have become increasingly complex. That, people have anxiety, depression, and OCD. They have ADD and OCD, and there feels like a lot. That is a definite. We know the numbers of mental health, the issues have increased, suicidal ideation, planning, attempts have increased. And also what I can tell you, and you and I talk about this all the time, is I feel a hum of just unbelievable anxiety in parents. And, we have this message, and I talk about this quite a bit, that we think if our kids are doing okay in school, grade wise, that there really can't just be sort of a hot mess on the inside. And that's not true. And I know a lot of your questions, some of your listeners put in questions, and thank you, were about what happens at college, what happens later, because they're seeing the level of distress, right? And college, just so everybody knows, the number one reason why a student leaves college is mental health. And 40% of college kids leave freshman year. Not all of that is mental health. Sometimes it's a transfer, not to freak you out. And I think sometimes parents don't really think about, all those little signs. They don't put it together until they're on their own and until they're facing, let's face it, a huge college bill. They start thinking, wait a second, is this the right time? Should I do it? And a lot of parents sort of ignore the signs. Not that you're doing anything wrong, but nobody's saying the young adult, this person at school, like, "Hey, I'm really worried." So they think, "Okay, well, you know what? Going to college will sort of sort it out." Well, I can tell you this: if you're on your own, and you're not don't have good support systems, and you're at college, the outcomes are not good. That is why kids leave, and there's nothing wrong with a kid leaving if they're getting help, right? And what we also know is that people did try to seek help during the pandemic. You can't always get help. But we also know that a lot of people are not getting help. So 70% of people diagnosed with depression, teens, are not getting consistent help. 70%. So right there, that's going to take away income levels. That's going to take away gender disparity. That means you're just not getting help. Certainly, we know that in minority populations, certain populations in general don't get as much help. But there's a lot to unpack there. But ultimately, really to answer your question, there has been a big increase in mental health issues in general, psychiatric medications, and we know through the Stress in America survey by the American Psychological Association, a massive increase in parent stress.
I mean, it's no, I mean, it's not surprising to hear that, but I feel like, during the pandemic, because there's no one listening that has ever been through that before. We
That's
were
right.
all as a nation, as a world in this massive shutdown. And I always try to find the reframe with my kids and say that we had a whole year of togetherness. It was just the four of us. We had sold a house, we were living in a rental, we're living in a different
That was
neighborhood.
not a fun time, Cynthia, just so you know. Remember
No, it was,
living
and I
in
was
that
right.
rental?
And I
Anyway,
was writing a book, which I don't recommend that you have all those things on your plate at the same time. But what's interesting is when I think back to the pandemic overall, there was so much bonding. Like, when's the last time my kids took Legos out? When's the last time my kids took puzzles out? When's the last time we played board games as a family? Because let's be honest, there wasn't a whole lot you could do other than, go to school, go to work, and hang out together, walk the dogs, connect over Zoom, connect by a phone, by a cell phone. And so, and you just get to a point where you can only saturate yourself with so much binging of Hulu, Netflix,
that's right.
Amazon Prime, whatever it is that you do, and exercise for that matter. So I think on a lot of different levels that we were all doing our very best. But I think for so many people, and certainly my oldest was impacted by the pandemic. That was his 8th grade year, missed 8th grade graduation, which, yes, in the part of the country I was in, 8th grade is a big deal. They do it up. They have a graduation ceremony, an 8th grade dance. He missed all of that and started high school from his bedroom. And I know
Oh,
that there are thousands and thousands of people that they have similar stories. They had younger children, they had older kids, they had kids in college, people who missed all these milestones. And so on a lot of different levels, there's a degree of grieving. Like, I think we as parents feel badly for our kids because they had this arrested development, this period of time where they weren't able to do the fun things they should be celebrating and enjoying. And so I'm so grateful that I have you here today to talk about many of these things. And there's a question that came in from Meg, saying, my teenage daughter and my adult son have suffered from social anxiety. Going to places that are crowded makes them uncomfortable. My daughter gets sweaty palms. My son rarely left the house other than school or work. What do you suggest to help them get more comfortable in uncomfortable situations?
yeah. Well, there's, I'm going to start with the end of her question and then go back, because learning how to tolerate uncomfortableness is the definition of resilience. And when we talk about, there are questions here about, what's the magic in mental health? That is the magic, right? So we have become like a bubble wrap society where we want our kids to never experience anything uncomfortable. I recently, if you follow me on my podcast, I talk a lot about my kids, but my youngest JC was a severe dyslexic. I mean, severe. And he only had dyslexia reading instruction. We never put him in a public school. We did it ourselves, and at a certain point, about 2 years in, where he was getting it between 5 and 7 times a week, I thought, is this damn kid ever going to read? But he did. And he's a totally normal reader, and he has the gift of a dyslexic brain. And, the number one common characteristic of millionaires, dyslexia. 40% of US businesses owned by dyslexics, very creative mind.
Wow.
And so we worked to try to skip a grade because he's a science phenom in math. And, we were kind of on the fence. I'm not so sure he was ready. And we said, listen, you're probably going to get a C when we use the summer to skip a grade. And now he's 2 years ahead in math. This is his choice. I'm not one of those mothers. Okay. So I was like, look, you can kind of struggle and probably get a C, or you could coast and get an A and you're still a year ahead. And he was like, yeah, let's get a C, right? And I was like, it doesn't mean you are, but I said, I'm predicting you're going to get some D's and F's. And he's like, what's a D? Never had, but he is uncomfortable. He's uncomfortable and I can see it. And I'm not, I'm like, we're pushing ahead. This is what we're doing. And it's a good lesson. And the poor kid's been used to being uncomfortable, but it doesn't mean you make everything hard. It means that we have to teach our kids there's going to be moments of uncomfortableness. Anxiety and anger can't be the only two emotions you ever experience. There's a range of emotions. And what are those tools and resources to get through them, right? That is what our job is as parents. And so we have this beautiful opportunity with our children to coach them in those 18 years through this, and also to model for them how we manage stress, never hiding that there are stressful periods, but showing them how we do it. So that's a little lesson from Dr. Rowe that I think is just we're not hearing this as much. And please know your kids watch everything you do, not saying they don't listen to you, but they're going to 10x pulling information from you just by observing how you're doing things. I mean, it's just the way. So to answer this question, let's talk about social anxiety. So first of all, social anxiety is the fifth most common mental health issue in America. It is not shyness, right? And if anybody doesn't know, Cynthia, she's an introvert.
Very much so. People are always shocked when they hear me say that. And so this is when you talk about resiliency and getting comfortable with being uncomfortable, that's one of the reasons why I did student government and why I ran for office in college and why I did all these things, because it forced me to get outside my comfort zone. And that's where growth and potential happens.
100% it does. Absolutely. Right. I'm on the other end. I'm the extrovert. I'm like, I have to learn how to be an introvert and be quiet sometimes. Right. And it's almost uncomfortable for me to be quiet. I'm like, okay, I'm used to, me, you like when I come with you because I schmooze everybody and we have a good time.
We balance each other out.
We
Yes.
balance each other out. Absolutely. And so shyness and social anxiety are very different. And social anxiety truly is a clinical issue. So how do you help your kid be more comfortable socially? Really, they require therapy, right? And my magic is calming the brain, coming in with therapeutic support in some way, shape, or form. It's just so much easier when we calm the brain. And no, I don't mean meds, right? So, what do I mean? So always the balance, the base of all health is nutrition. So you do what you can with nutrition. We can talk about that. You can use meditation, you can use yoga, you can do breath work, you can do neurofeedback, you can do PMF. Of course, you can do supplements like inositol and magnesium. There's a lot of good things we can do, always evidence-based, but you must do them consistently. I don't want to hear you. Don't message me if you haven't done it for a month, right? So it's not one and done. Even though the number one quickest thing we can do to calm our nervous system, breath work. It's the fastest way we can calm our nervous system. But that child, that young adult, I think it's both her kids, right? We have to help them. Doesn't mean that they are going to be the head of the student council, right? But you have to help them gain social skills in some way, shape, or form that is right for them, right? So I literally could go anywhere and I'm going to be fine, right? I'm not asking you to do that, right? But what can you do? Because guess what? You're going to have to go to college. You're going to get a job. You need those skills. And you don't want it to bubble over. I mean, untreated anxiety pretty much always leads to depression at a certain point. And then there becomes the layers. So calm that nervous system, get them the skills. That really sounds easy, but it's not, but it's worth that effort.
Yeah, and I would imagine that there are parents who are listening right now or listening later in our discussion. How do they go about finding qualified providers? Because it's my understanding from talking to my traditional allopathic trained friends, there aren't enough mental health professionals. And this is unfortunate. How do we go about finding qualified individuals to work with our children, our teens, our young adults? Because I would imagine that this in and of itself is its own specialty. Like there are people who do better with grown-up adults, and then there are people who are really patient and very attuned to children, teens, and young adults. And I would imagine in and of itself, that is very much a very specific focus.
Yeah. So great point. So what you want to do is find somebody who has an expertise in that specific problem. So in social anxiety, you want to say, have you worked with people, young adults, teenagers? Because an adult therapist, man, they don't know what they're doing. They don't know how to talk. I was, driving in the soccer carpool the other day, and the kids were like, "Oh, you don't know this rapper." I said, "Yeah, let me hear his name. I'll tell you who he is." And they were like, "Oh, she knows who he is." I was like, "I gotta stay current, kids. I work with
Mhm.
teenagers." You know what I mean? Plus, I love music, but I was like, "I at least wanna know who it is." So, I joke, but I don't, because teenagers need to know that you're relatable in some way, shape, or form, and that just requires that you're putting that effort in. So, do they have a specialty? Where are you gonna find them? So, number one, start with somebody you trust. If you have a friend who's had a kid with problems, ask them. And if they've had a great experience with a local provider, do that. If you can't do that, ask a medical professional. And certainly you can do a Google search. I mean, people come to me all the time from all over the world in a Google search, and you want to make sure they're licensed, credentialed. You don't want to go to somebody who is a mental health coach. You want to make sure they are properly credentialed. Is a mental health coach great for things like parenting or mindset? Great, sure. But when it comes to a clinical issue, you really got to know what you're doing. And there's so much work that you have to do, not just to get that degree, but to get that license. And making sure that's where the results come from. I have a whole podcast on why expert care is, important, because it's just a very different experience when you go to an expert, non-comparable, really. So there are great providers in the world. You just have to look for them.
Yeah,
And
I think
once
it's
you meet with them, are they the right fit? That's important too. If your child can't relate to that person, and it's truly an issue of relating, not treatment refusal, um, then find another person. But I think one of the questions, it has to, do with, how, what do I do with a kid? How do I talk to them about it? How do I get them for help? So one, conversations are never one and done. You have open conversations about mental health. You never make it negative. You really just try to make it a positive thing. Never hide clinical diagnoses from kids. It's often a relief when they're like, "Yeah, I know I was depressed." And then really talk to them and be part of that therapy if you can. I mean, really, if you are the parent, you're doing the heavy lifting, because one therapy session a week isn't going to move the dial if you're not implementing those things at home. And you can. I want you to be empowered, not scared by that. It's going to teach you to get in alignment and use the right words instead of, being like, what am I doing? Spaghetti on the wall. That's what a therapist is for. They're there to guide you and your child.
That's such an important point and certainly really helpful because I would imagine there are going to be parents that are going to listen to this and they're going to say, I know that my child needs help, but I don't know where to start. So thank you so much for that. Suzanne asked, how do you think universities should best support nutrition on campus? And what do you feel is missing most to allow all students, in caps, including those with food intolerances, to have a level academic playing field for best success? Great
Yeah.
question.
Suzanne, I've helped so many kids pick colleges, and so many of the students that I work with have food intolerances, have celiac, have medical conditions that prevent them from, that we have to get their inflammation down. And it's hard to find really good nutrition at schools. Do I see a trend in the last few years where things are improving, that they have these apps now where students can order food? I think all schools have to just like restaurants, have to acknowledge that you got to have a little gluten-free symbol. You have to have options. And we know that food quality is a big determining factor in health. And yet, there are many campuses, like I had somebody this summer and they're like, the primary food method of cooking is frying. And I'm like,
Um,
really? Like everything is fried, and then in the same breath, I have, another student who goes to one of the top food schools, always in the top 10 here. They have a sushi bar, they have this, they have that. And I was like, I couldn't even imagine that. It's so great. So, what do I think universities need to do is I think they need to provide better food options for all students, right? And also to bring taste to those foods. Like you can't just have grilled chicken. So, a lot of my kids who have food intolerances, they literally have to have the same food choices every day. Like, I can't live like that. That gets boring. So, in one sense, you're providing safe options, but they have to do a better job with taste. And I think just like when people come to my house, they're surprised that everything's gluten and dairy free because it's just so darn good. It's just a matter of proper spicing and having some variety.
yeah, and it's interesting. I have my 18-year-old will be going to college in 2024, and you better believe, especially because I'm the mom of all boys,
Mhm.
when we're doing college tours, he's very attuned to the food options. He has peanut and tree nut allergies, so that is a huge, and he has real allergies. They're not going to go away. Unfortunately, only 30% of kids that are diagnosed with a food allergy will actually, quote unquote, outgrow it. And in talking to him, one university in particular is always in the top 5 for food options. And it's amazing how some universities just have an overwhelming amount of choices. Unfortunately, that's not consistent. And so I completely
Yeah.
understand I hear what you're saying. And I also understand what Suzanne is saying is that, what do these kids do? So obviously for us, we have to make sure wherever he ends up attending, that they're going to have safety parameters around contamination with nuts and peanuts.
A lot of
And
investigating. My
yes.
friend Ellen was like, she guides me in all things. Her kids are older than me. They're adults, and my kids, I should say. And she was like, "Bro, you got to check what they're feeding the kids, and how often they're cleaning the bathrooms." I was like, Ellen, I would never think of that, but it's true. So I think that's really the answer is what you have to do your investigating work before you get there. And
Yeah.
and I would really even say, like, I would go to those dining halls and taste the food. Because sometimes things have been promised, and again, that quality isn't there. Certainly, another option is for kids to get. I've had kids get special rooms where they have access to cooking and they just cook themselves. That's not as typical. You've got to be a really pretty self-sufficient kid who really knows how to cook.
Yeah. Yeah. It's interesting. Both my boys were at a university this summer for a program. And one came home and said, "Oh, I'm going to definitely gain 15 pounds because I couldn't believe how much food was available whenever we wanted it, as much as we wanted of it." And the other one came home and said, "I miss our home cooking." So they were at
Mm.
the same university, but their perceptions were completely different. Along this line, Jen asked, how do you recommend talking to a 14-year-old girl about avoiding gluten and dairy as needed due to severe intolerances without creating disordered eating behaviors? Now, I know you and I have had some conversations around this. Um, Obviously, it's a very kind of sticky subject because you don't want to then imprint your child with being overtly concerned and becoming orthorexic, anorexic, binge eating, food addiction, etc. How do you typically address those kinds of concerns?
Well, you're right. You have to tread carefully, right? And especially if this is new at 14, right? If this has always been going on, it's different because there's a foundation, there's a trust, there's an understanding. I'm not saying these are not, tricky to navigate in either scenario, but let's say that's new, right? Well, Number one is you've got to do this as a family. I think the greatest mistake people make is they make it for just the one kid, and they're
Mhm.
already feeling so bad about it. And you're listening to this podcast. This is the way for better health, brain health. I mean, when I do my brain scans and people are eating, they're intermittent fasters or paleo, they're keto, you can't believe the difference in their brains of any age. The inflammation is not there in the same way, if at all. The stress levels, the even just the neuroplasticity, the flexibility of the brain is incomparable, regardless of age. I can get a 70-year-old who's eating super, super clean and a 14-year-old that's eating chicken nuggets, and that 70-year-old brain is going to be way easier to train. And, I never try, I only get to tell that to my good eaters because everyone else feels bad. But you want to start with your whole family, really, getting rid of the stuff. You're all going to feel better. It's going to be easier. You're not going to be locking horns as much. And then, you psychoeducate. Like I slip in like nutrient facts. I also really try to get my kids to connect how they feel when they eat. So like, wow, how do you feel? I made a baked berry compote thing with almond flour and butter in it last week. And my kids were like, this is so good, and I was like, it is. There was nothing terrible in there, it was just baked fruit, it was a dessert. And I was like, oh, do you like it better than da, da, da? And they're like, oh no, this is way better. I'd rather have this than the gluten-free, whatever it was. And so you just get them to connect. And obviously you want to validate feelings. If your 14-year-old is angry that they can't eat certain things, be like, yeah, me too. God, I'd love to have a Cinnabon, and it not affect me, whatever it is, but it does, and things like that. So, I mean, my kids have been drinking the Kool-Aid long enough where they get it. But it is hard, and I've had some real. And the other thing is sometimes having another person talk to them is huge. So you have to be very careful if you find a traditional clinical nutritionist. A lot of times they're not down with super healthy eating. They're like, "Oh, you can have a little bit of everything."
Your
Really?
heart healthy grains. If you hear that, run. Please
you know
run.
but you can find an integrative health coach. You can find somebody. I certainly have had many conversations with kids and families, and sometimes I even do like, hey, could you do me a favor, could we do it for like 3 months and we'll do a pre and post brain map. Like it really depends on where people are at. I met with a young man this week, and we he had to give up stuff, and we based it on his stomach hurting. And he was like, a month later, he's like, "My stomach's not hurting." And I was like, "Well, what do you think?" He's like, "Well, I guess I have to stick on the gluten free." And I was like, "Yeah." I was like, "You look great too." And he's like, "I feel a lot better." So he was, 20 years old. So, and he was not too happy with me when I told him we had to be gluten free. He said he's done it before and it did nothing.
Well,
So,
it's
you
hard,
know,
especially at that age, because I feel like teenagers and young adults, they feel like they're missing out. And I'll share with my community that my youngest, who's 16, has been struggling with, pimples and like very mild acne. And, we've been bringing him to a local holistic person, and she's been reinforcing, you really should go gluten and dairy free. And he has just dug his heels in the ground. And I said, I can't force him to do it. And something over the summer, it was like a light bulb went off for him. And he said, I'm willing to go dairy free. Do you know that that kid's skin looks completely different? And so he tried probably 2 weeks ago to have a little bit of, I think he had whey protein, and he had a bunch of breakouts, and he said, I don't
see,
tolerate dairy. And so he and I are dairy free buddies. I keep saying to him, like, I will do everything I can to find healthy alternatives for you if you really feel like you're missing something. And in most instances, with the exception of ice cream, he doesn't miss it at all. But his skin has gotten so much better. And I never pushed him. I just said, you're going to come to this decision when you're ready. And now that he's ready, the dermatologist, the anesthetician are like, oh my gosh, I cannot believe the difference in his skin. We were actually looking at photos that they had taken, and he's so proud of himself now. And he just said, it just reinforces, I want to have clear skin, and I'm not willing to go back to having a face full of pimples. And so for him, dairy is very inflammatory, very
that's right.
insulinemic. He's in the midst of puberty. So spiking insulin for him is going to drive the acne issues. And so I just share that so that our community knows, as a parent, I had to kind of wait till he was really ready to do it, because if I pushed him to do it before he was ready, if any of you have a stubborn teenager, you
Yeah.
understand it's like trying to push a mule. And so I love him to pieces, and I'm so proud of him because he came to this all on his own. He was really ready to just be done with these skin problems. So
Well, and you
it was,
handled it beautifully. You're like, okay, well, you can have the skin problems or you can get rid of dairy and not. So it's really up to you and you let him, decide, right? And skin is our largest organ and so much toxins want to come out through that. And for him, it was created a toxicity. Who knows? Maybe there's candida in there. It could have caused a lot of different components for it. Yeah.
when you talk about a brain scan, can you explain the technology that you're using in your practice? Because I'm sure people are probably curious. They're thinking like CAT scans, MRIs, but this is different.
Yeah. So I do something called a QEEG brain map. And sometimes people come to me and just do diagnostics with me. They come in, it's this process where it's a lovely, non-invasive process. I can do it as somebody young as 3.5 to whatever age, and I do it all the time. So you put a cap on, it measures surface electrical activity at 19 sites. And what happens is we take this data, and it's no big deal. It's this cap. The worst part of it is like you get this gel in your hair and it's kind of gross, but that's it, right? When you're there, it's like 10 minutes, no nuclear medicine or anything. So the data, we take it, we analyze the data, we put it in a database, and you're compared against males and females with and without clinical issues around your age, right? And so I am sort of like a savant with these brain maps. I'm not shy either and I look at a brain map and literally you can just see so much in a brain map. So you can see what areas are underworking and overworking. That will tell you, oh, this is overworking in brain communication. That's associated with anxiety. Oh, look, there's OCD. I have done over 10,000 of these. I stopped counting at 10,000. And I can see certain nutrient deficiencies. I can see what your gut health is like. I can see permeability in the gut. And that's all based on patterns. So we know exactly what the brain can and can't do. When you see certain patterns together, you're like, wow, that's a head injury. Oh, that's a birth trauma. I freaked people out at times just by doing this brain map. And you're really able to get not just accurate diagnostic information, but really my specialty is to say, this is what you should do. And these are the kind of treatments that will help you based on your brain profile. I have 100% accuracy if I see Lyme disease or tick-borne illness. And how do I know it's 100%? Because I send you to a physician and you go and get tested. So, that's the kind of information you can get out of a brain map. It's great. And half the time people come to me, they have the wrong diagnosis. And I would say that's conservative.
Yeah, no, it's really interesting. I know that, being friends with you, you've talked about this a lot, but this is really the first time we've discussed it on the podcast. So I was like, I'm going to let you describe it in more explicit detail than I could. Next question is from Nicole. I have a 15-year-old daughter who has no interest in sleepover at friends' houses. She tells me it makes her anxious to be away overnight and she wants to sleep in her own bed. She has scoliosis and wears a brace 23 hours a day, and this contributes to wanting to be in the comfort of her own bed. She has a desire to get past this, but it gives her so much anxiety. As a parent, I want her to grow beyond this anxiety, but wonder how imperative sleepovers actually are. I worry about whether this will make college a tougher transition. Any advice would be appreciated. You're seeing common themes that are kind of weaving through these
Yeah, yeah.
questions.
So let's talk about girls and sleepovers. It's kind of a big deal socially, right? So I understand that. And this is not the first time, like I've actually had people come to me to help their kids do sleepovers only when the kid wants to do it. I'm not going to force anybody to do anything. So we have to honor your daughter, right? So we now know she has scoliosis. The brace is very uncomfortable. It really, really is. My friend Ellen, she had scoliosis. My JC had a touch of scoliosis. We were able to do the exercises. So I would say, is this really a priority for your daughter? Because if it is, then it's something we should work towards. If it's not, I think it's okay for her to say, I want to be in my own bed. I'm uncomfortable. Maybe she doesn't want people to see her in the brace. there could be a lot underneath it. I think the larger thing is, let's look back, right? Let's take an aerial view. And is this anxiety showing up anywhere else? If it's just showing up here, that's okay. We have to honor our kids when they don't want to do certain things. But if it's showing up in a lot of other ways, she might need some counseling support around this diagnosis and how it affects her, because we hear scoliosis and we kind of push it to the side. It's sort of a big deal.
Mhm.
And she's going to be wearing that brace until she stops growing.
Yeah. And I think it's such a good question because I have one kid who loves spending the night out and the other one who really never has. He enjoyed having people at our house pre-pandemic. But I think it's to your point, like honoring our kids. Like I have one kid who always wants to sleep at home. He prefers his bed. He doesn't want to sleep on someone's couch or floor or in a sleeping bag. And the other one could care less. So I think so much of it's just honoring our kids as individuals, figuring out if she really has a desire to be doing sleepovers. That's a separate issue from just saying,
Definitely.
hey, I just want to be at home and sleep in my own bed, which I think all of us can respect. Next question is from Ashley. Hi, I like your huge following. I'm a huge fan. Thank you for your work and bringing this to the teen community. I have two teens and one tween. Any advice on acne? I have
Oh,
one who weathered it, one on Accutane, and the one coming up the pipeline.
well, I mean, I think we kind of discussed that, but I think ultimately, what are big factors in acne, right? What you're eating, your stress levels, and proper detoxification. And they all can be related. So, getting a good, healthy diet, keeping your blood sugar stable, and also making sure, I mean, most acne isn't because kids aren't taking good care of their skin. It's really about what they're putting in their body and it's showing up in their skin. So, good detoxification processes and practices. I think a lot of times we don't think about that for our kids, but they need to get a good sweat in every day. The point of sweat is about 7 to 8 minutes in. So, aim for 20 minutes. And lots of water with lemon. Never put water with lemon in anything but a glass, ceramic, or metal cup, never plastic. And use other things to help them detoxify. Tends to turn around. Now you can also look for things like I mentioned, yeast. There could be other things lurking within the system, and you're only going to find help for that with a holistic integrative practitioner. You're wasting your time going to a regular doctor. They're just not going to think that it's in your organs. um and that's really the way, and getting your kid to buy into the healthy eating, and really just like what Cynthia said, like, wow, take a look at your skin. What are you doing differently? Because when they go off the wagon, whether it's, gastrointestinal, whatever symptom they have, you want them to make that connection so they make the choices for themselves.
That's such a good point. And it's interesting because my 16-year-old, my stubbornly wonderful child that he is, when he was ready to make that elimination, he was. But to his credit, he found that for him, his way of dealing with stress, because he goes to a magnet high school that's like college. I mean, I'm not exaggerating. His workload is insane, but he loves it. He's very happy. He's thriving there. He goes to the gym. He goes to the gym 5 days a week. He's very, very specific about what he eats, what he's doing around the gym, gets his exercise on. He's a much more pleasant person. So don't discount that element of stress for our kids. I think a lot of them internalize it. And, for me, it's been interesting to kind of watch this transition for him over the last year. But I love that you brought up the detox portion because that's equally important. And the other thing that I would kind of echo is there are so many functionally and integrative medicine individuals that, you could work concurrently with your pediatrician to make sure that there's not something else going on with your child. And then there are lots of very well-trained individuals who can do stool testing, that can do food sensitivity testing. In concurrently, when you're working with an allopathic trained provider, I mean, they do exist, they are out there. I have several on my team and they really do a great job, looking at those nuances. You mentioned candida, dysbiosis, latent infections, all the things that can really manifest in what's going on in the skin. Next question. What recommendations would you give to a mom of 3 children, 2 in elementary school who have special needs when it comes to managing behaviors at school and at home? I feel like we've tried everything. My husband works a lot and I work full time. So I feel like we end up using screen time too much. And that makes the school day far more challenging. I feel like I'm constantly being called or pulled into meetings. And I also have a 5-month-old. So this mom is exhausted. Sounds like
Oh,
she needs help.
yeah. I wish I had an easy thing for you, girl. So, I mean, other than sending you a lot of mom love, but I think, when kids are dysregulated, right, we have to understand why they're dysregulated because that's what you're talking about. If your kid's having behavioral issues at school, behavioral issues at home, number one, put your own oxygen mask on. You got a 5-year-old, give yourself some grace. But, what can you do even small amounts of the day to, maybe improve your sleep or just tighten up what you're eating just to give yourself a basis that's easier to work from. Because if your, stress, sleep, diet are off, you're just not going to show up in the best way. And of course, your stress levels are going to be high. You have special needs kids and a baby, you know. So do what you can right there. But then think about when you have kids with behavioral issues, what's your structure? What's your routine? What do you have in place to increase learning? Because structure and routine help kids who learn differently, who need a minimum of 3x the amount of repetition. So it takes 34 times to do something where you learn it at an innate level without thinking about it. If you have any kind of issue interfering with learning, it's 3 times that. So let's just say it's 100 plus. So that's why us special needs parents are tired because we're repeating ourselves. But when we put the scaffolding in, they're better off. They're able to learn quicker. And then, really also, I find as a special needs parent, 80% of the parents do get divorced. And I'm going to say that, and we're not saying that, but 80% of the parents who come to me are not viewing their child's issue and how it's treated the same. And most of my work is in joining the parents. So whatever you can do to get dad to see the problem in the same way, a lot of parents, have an aha moment on one of my episodes or one of my blogs, and they send it to the dad, going to a therapist, doing something to align with it. And if your kid's really struggling in school, and you need to have help, you need to get an advocate, somebody that can help. And ultimately, kids that are special needs, their brains can learn. They need more support in regulating their nervous system. That's why the diet is even more important. And then tools like I use, like neurofeedback and PEMF. I mean, they can just be game changers. But you don't have to go down the medication road. And I, in fact, find, and I'm always very transparent. That's the people that seek me out. I find that it often doesn't help and can worsen things. You got to go back to those basics in order to help your kids really learn.
Yeah, thank you so much for that because I one thing that my admin, Jamie, for everyone that emails the podcast, Jamie is my amazing executive admin. And she was saying there were so many common themes of parents needing and asking for support. And so obviously it's easy to have Dr. Rowe come back, keep the questions coming. We actually have a few more questions I want to try to tackle. Next, this is another anonymous question. My son has what appears to be OCD, but he's only 3. Is it possible for kids to show signs of something like this, but then quote unquote grow out of it? Or are there things I can do to help him manage these behaviors without having to see a professional? I think it's related to social anxiety, but we try to get him out of the house, interact with other kids at least a couple times a week.
So yes, OCD can show up as young as 3, right? And no, you don't want to wait getting help. So it's super ridiculously important. I mean, OCD is one of the most treatment resistant conditions because it forms a habit in the brain and just puts a lock on the brain and the brain gets reinforced for either avoiding certain things or, the questions it asks, the rituals, all that, it gets reinforced. So it's just much more likely to occur. And at this young, you could squash it pretty easily with the support of a licensed mental health professional who does a type of therapy called ERP, which is exposure, response, and prevention. It's a combination of cognitive behavioral, even a 3-year-old, we got to challenge those cognitions and the behaviors with exposures. And a good ERP therapist is going to show you how to manage those behaviors, how to avoid things. Because most parents don't realize when your kid has obsessions and compulsions, they're actually involving you and you're accidentally reinforcing it. So there's a lot that can be done. I highly doubt with a 3-year-old, you're going to need to go to therapy for a million years, but you will not regret getting help. And that's the same statement I would make for anybody at any age with OCD. Like, it is so powerful. All the evidence shows you that that's the sort of the gold standard in treating OCD. And please know that OCD should be treated by an OCD expert, not an anxiety expert. Anxiety and OCD are not the same. And if you treat it like anxiety, you can accidentally reinforce it and make it worse.
Yeah, I will just add something personally. I'm not given permission to disclose the individual within my family network that has OCD, but it is really important to make sure you work with someone that specifically works with OCD patients and their families. And more often than not, OCD kiddos, they reinforce the habits that they need to have reinforced to, continue with the behavior. Like, parents don't realize that their own behavioral patterns are reinforcing their child's OCD. And I say
It's
this
so
like in the
sneaky,
most
right?
loving way possible. And so part of addressing OCD in children, teens, tweens, young adults is reprogramming parents. It's amazing.
100%. And when they start to make the connections of the sneaky OCD behaviors and how they've accidentally reinforced it, they're like, oh gosh. But, in the same breath, I'm all about parent empowerment. Once you know, and you can do something different and you won't spin your wheels in the same way. You can just squash that OCD.
Yeah, absolutely. Absolutely. Okay. Next question is from Jen. How do you recommend encouraging a 16-year-old high school junior to get good grades, test scores, and extracurricular without obsessing or having them tune you out?
Oh, it's so hard. And I am such an alternative educator in my own, I have one child that's homeschooled, another we go to a Montessori school. And it's he's in the middle school part and it's only Montessori infused, right? Cynthia's got one kid in high level charter, another in a public school. So we kind of tick all the boxes on parenting. And I think it's about balance. And I don't have the exact right answer because I think every family is different. So, one, the best way to do things in your family is to model how you manage stress well, not perfectly, but even when you're imperfect, to be like, well, I could have handled that better, and just to talk about it because we don't want our kids to get the message that there's only one route, perfection. And that is the message kids are getting today. So I don't know from this question if you're somebody who wants your kid to do better or you want to know how to support them and maybe you're a little more chill. And I think I've had all kinds of parents, right? Many years ago, my mother's helper, my former intern, she's a Yale doctor now. And her mom, Claire, and I've been friends for like over 20 something years. And Claire and I are super chill kind of parents. And we're like, where did she come from? She's so intense. She's got to be in the top, whatever she's in, I think she was number 3 in her class. And she just struggled with getting everything right, internalizing it. And we used to be like, honey, you're going to get anxious. You're going to get anxious. And that's certainly what happened. And we taught her how to use heart math and she wound up turning around. So I think the message here is that in order to power up the brain, you have to power down. So you have to help your child to regulate. So whether that's things like you're going to yoga 3 times a week together, you're doing, and the brain needs 10 or more minutes a day of some calm, relaxing activity in order to reset itself. Yes, sleep is very important and a lot happens in sleep, but you need to be intentful about what you're doing. So maybe you're doing some heart math. Maybe you're doing meditation. I don't know what it is, but I think that is how you help your child to be more regulated so they can achieve at a higher level. But not even just achieving at a higher level, but doing it in a way where they can recognize where something feels off. Because if you're only in a rev state, that's all you can feel. In terms of motivation, you know, that is something people come to me a lot about, and I think why kids struggle with motivation in general, it could be that there's an underlying clinical issue, maybe the task that they're having them do isn't something they really wanna do, and they're just going through the motions. Maybe they're missing a passion in their life too. I feel like a lot of times kids are just, like, driven to the academics, and so rarely do I have a kid who's really certain about what they want to do in their future in a way that aligns with who they are. Like whenever I tell people that JC like decided in 5th grade he was getting his PhD in engineering, I had the robotics guy come to me and he was like, "Don't you think that's a lot of pressure?" I go, "I have nothing to do with this." Like he just decided. And I was like, "Well, if you decide to do that or you decide to get a degree in like art," he's like, "Mom, I love art, but I don't want a degree in art." It's like, "Well, you might be a chef." I just like to cook for fun, and I was like, "Well, whatever you decide, but we kind of have to, prepare for that if that's what you want to do." He's like, "Okay," like, and we we just have to you have to work with who you have too, right? So I think sometimes our kids have lofty goals and we want to support them, like in the case of mine, but I'm super realistic about it. And I know how important grades are, and I also know that grades are much more likely to get you merit scholarships than sports. So that is what I consistently see. So I know how expensive college is, and I don't want to say, "Well, let your kid be a B student." Well, they might not get merit scholarships. So finding that balance, but making sure your child has good mental health is just so important because those grades don't matter if they don't got it together.
Yeah, it's interesting. We left a part of the state that had one of the highest rates of teen suicide in the entire state. And for me, I've always had a sense of like my kids and like where they fall. They're both bright. Let me be clear. One is an introvert and needs a lot of downtime. The other one is revved up and ready to go all the time. And it's been interesting to watch them navigate high school. Like, as an example, number two kiddo yesterday came with me to cryotherapy. And not only did he want to go to cryotherapy, we were actually in the same like cryo cell at the same time, which was kind of cool. And he goes in there with just a like a waist towel on. And I go in there in a robe and take it off if I decide I want to get really cold.
Oh my
And I
god, you're
said to
crazy, girl. I'm not
yeah,
going in there.
no, it's actually really cool. But what was interesting, I said to Liam, how do you manage being in a cryotherapy tank when it's, as cold as it is for the duration of time that we're in there, which is like 3 minutes? It's all very safe. Let me be clear.
No, I know
Uh,
it's safe. I just
yeah,
hate
yeah.
being cold.
No, no, no. But he said, I meditate. He's like, I just go to a different place and I'm very
So cool.
relaxed. And so for him, he acknowledges that's something that he needs to bring him down. So I think in many ways, I think our kids know what they need to do to manage their stress. We sometimes impose our own thoughts on them. And so I found that my kids have kind of figured out what they need to do. It usually involves exercise, but the cryo tank with him being in there, I forget how cold it was yesterday for 3 minutes. And he was very zen. He was just meditating and, I was the one that was kind of moving my legs up and down
Don't you
just to
love
keep it.
when they use the things that we teach them on their
Mhm.
own with no cueing? I think that's the
Exactly.
coolest part about having a teenager where you've been fostering it the whole time,
Yeah.
you know? I'm
They
like, "Oh,
model the behavior.
they
They do
are
for sure.
listening. They're
Yeah.
listening and watching."
Yeah. Last two questions. This is for Meg, mental health. Oh, how I get upset about our healthcare system. My sister suffered from mental health problems. I lost her to suicide. How does our healthcare system treat these patients as adults, meaning that they can make their own decisions? They are not capable of doing that. How can I make a difference in a person's life when I have no say? So I think what she's talking about is, and whether listeners know this or not, unless someone is actively suicidal,
Mhm.
wanting to harm themselves, someone else, you can't force them to do anything. And I think that's what Meg is speaking
Yeah.
to. But when
Yeah.
you have patients that are young adults, teenagers, et cetera, and they're at that point, either they're expressing suicidal ideations or they have a history of attempted suicide, what are ways that families can support these loved ones in a way that's helpful and not harmful?
Yeah. I mean, I think number 1 is not getting band-aided help, like really doing deep work. I think a lot of times when I get somebody who's, at that level, which I have very complex cases. So, it's not terribly unusual. They're getting to me, and it's a lot of medication, medication, medication. It's not really deeper therapy or even really looking at a functional level, like, what's their thyroid like? Is there infectious disease? So really getting to the bottom of it so that we can then build up, I think is a big fault in our mental health system. I've been asking every one of my patients now, I send them for genetic, full genetic variant profile, because it's gotten so easy now to do, and it will tell you like what food you should eat, what nutrients you
Mm.
should have. Oh yeah, I have a great one that I've been using. So and so it helps, right? It just helps them along their journey. Like, why are you asking me to get rid of this food? Well, now we have data, right? Because I'm a lover of data. So, what can you do? How lovely, and I'm sorry that this woman lost her sister because she couldn't get the proper help. I think, educating people, like, you will never regret getting mental health help. The amount of people that are not getting help, kids that, it's unbelievable. So overall, 50% of kids who have a diagnosed mental health help are not getting help. So I think that's pretty scary, and don't think just because they are getting help at school that you're off the hook. I recently had somebody and they were very angry with me because they were like, you just keep insisting they get therapy, but they're getting it at school. And I was like, you need parenting help. The school is under no obligation to give you parenting help. And you're struggling on how to raise this kid. And there's nothing wrong with that. We are literally not equipped to support kids who have behavioral issues or mental health issues. So, educating people, volunteering in places where you can help get the message out, because again, people don't know what the long-term implications are. And a lot of times they say, well, I did this medication or I went to therapy every other week for 6 months or whatever it was, but did it really get to the root cause? Did you really get to this place where this behavior or issue is manageable? Because sometimes they just don't understand that there are other things in the world to support mental health.
Thank you for that. I think it's really important. Many years ago, I worked at a hospital that was across the street from Shepherd Pratt. So one of the leading psychiatric institutions at that time. And we did a lot of the intake and people would come through. And it was so clear to me, even 25 years ago, how poorly equipped allopathic medicine is. And at that time, we still had psychiatrists that would come through and see patients in the ER. And from what I understand now, it's like, it's really hard to get that support, and mental health and physical health go hand in hand. It's not one is superior to the other. Last question. I just want to wrap up with that article that you had sent me talking about the impact of the pandemic on teenagers, young adults' brains. And there was a professor at University of Washington who noticed, looking at all of these changes on scans in adolescent brains during the pandemic, that there was this abnormal and premature thinning of the brain's cortical surface, the outer layer of the brain. You normally thins with aging, so that's
That's
normal,
right.
but it's abnormal to be so thin among teenagers. This is indicative of high levels of chronic stress and trauma, and it was more prominent in female adolescents than males. And so really interesting to me that maybe we don't understand fully as parents. We assume that, we're 3 years out, things are better. And I think it just really speaks to the fact that we still have to be aware that our kids' brains are still developing. The prefrontal cortex is not fully developed until they're 25, which means
Mhm.
they sometimes make knucklehead decisions. My poor kids know this because I'll say to them, you're making an amygdala decision. Your reptilian brain is overriding your prefrontal cortex. But Suzanne's last question is specific to this. What do you think is creating the most stress for current university students post-pandemic? What do you think universities need to do to improve and foster an emotionally healthy and supportive environment? Really great question, not an easy answer.
Well, I do feel like there's an easy answer. I feel that there's no stress tolerance anymore. I mean, with kids and adults, like, we don't understand, like, we again, that whole idea of bubble wrapping, right? That we're not letting our kids experience failure. Then problem solve on their own. We're a lot of rescuing of parents, of kids, and when kids are getting to college, they don't know how to do a lot without so much intervention, right? And kids are getting on airplanes and going across the United States. And I recently had a friend of mine send her child with unresolved mental health issues, even though had a lot of support. And she was like, "What should I do, Roseann?" And I was like, you have these two options, honey. You're either going to say he's going to take a whole year and you're going to do some of these things that you've been sort of trying to do while he's in school and give him a gap year, or you're going to put all these beautiful interventions you have in place and let him go to school. And he is struggling. And and she couldn't have done a better job with what she did in terms of putting interventions in school. But ultimately, in the end, he wasn't okay to go away. And when you're thinking about your kid going to school, you're thinking about the comforter. You're thinking
Mhm.
about their meal plan. You're thinking about all those things. I'm not saying they're not exciting and important, but you have to say to yourself, does my child know how to. When I went to college, my mother set me straight. She was like, people are going to put drugs in your stuff. Guys, my mother famously used to say, guys want to clean your pipes. That's what she would say, right? But she taught me like some street smarts,
Mhm.
and boy, did it serve me, unbelievably serve me. She didn't sugarcoat things. And is 1980s parenting, right? It's not 2023 parenting. We always have to change with what we're doing. So think about, does your child know how to cope with stress? Right. And I'm not just talking about academic stress. What about a friendship breakup or a betrayal? Like, do you have good communication with your child before they go to school? Are they going to ask for help from you? I mean, a lot of times kids, I had somebody, go through many times I've had somebody, but this year in particular, where I had somebody go through a whole year of school and just lie about going to class, the grades, everything, because they had severe OCD and were too embarrassed to tell their parents about it, right? So the real answer is good coping skills, giving them plenty of practice opportunities before they go there. And what's college's responsibilities for student mental health? I mean, I think colleges, they do a pretty decent job. They have um student mental health centers. Can they do more events for speaking? Can they do more events for stress management? Absolutely. And you can call me because I do them. But but we could do more of that. They're in a place where they're learning, and so they're more open to these ideas. So having speakers come do more interactive things, I think, are important. And colleges want to retain students too. They want to see their kids be healthy and graduate well. And it's there's a lot of pressure, And I think also to educate your students about drug usage, especially when marijuana and mushrooms and things like that are almost like no big deal. I can't even tell you how many times I've had people have psychotic episodes from both of those. So, I'm always like, kids, stick to clean liquor, have a buddy when you're drinking, cover your cup. You know what I mean? As my mother would say. So educate them, don't assume, never shame your kids. Try to really be there and relatable and, let them fail a little bit before. I mean, it's really important to let your kids fail. I can't tell you how much it helps you develop grit.
Yeah, no, I can't agree more. And we just published a podcast with Dr. Yee talking, he's an addiction and holistic psychiatrist, and he was talking about this is not the pot from the 1970s, that
No,
it
it's
is so much
not.
more potent, that it is a gateway drug, that it does developmentally impact young brains quite significantly. We talked a lot about fentanyl and how that's working its way into so many different things. I really have to echo a lot of your concerns. Now, one thing we didn't talk much about today, but we did get a couple questions around are supplements. I know that you're an advocate of lifestyle first. And so, what supplements, as a clinical psychologist, do you feel like most of your patients benefit from in terms of supporting mental health? Because I know that you have a new product that's out that I want to make sure we highlight, because I think everyone needs more
Yeah.
magnesium in their lives.
Well, my company is called Neurotastic, and I developed a magnesium because I do believe it is the number one nutrient we need for children's brains, but all brains. And I put in the most bioavailable forms of magnesium that really go in and start supporting the brain immediately. So magnesium is a non-negotiable for me, as well as vitamin D. I think, and the combination is pretty incredible. And then when I really kind of look out, what are the top things kids are affected with? So almost 10% of the US population has ADHD. 9.5% have anxiety. I think that's a lowball estimate. By the way, that's the CDC, and it's before the pandemic. And then depression is, well, it says it's only about 5%, but 15% of 13 to 17-year-olds have depression. And so when I think about what do people need, right? It's a lot of focus, it's a lot of anxiety, and there's also behavioral issues in there too. About almost 10% have a behavioral issue. So what are other things that really help? So I am a big fan of inositol in terms of calming the nervous system, really, really helping to regulate it. It's easy to use. I mean, Cynthia's got the powder. You can just pop it in. You can even mix it with magnesium, you could throw it in a smoothie. I mean, it's just easy, right? And it also really can help you. Both of those can help lower those stress levels for sleep, which I think most of our teens are just not getting good quality sleep, and they're shortchanging their sleep to do their homework. Don't you
Yeah,
agree?
I totally agree. And in fact,
Yeah.
my youngest, who has heavy school workload, he takes magnesium dutifully and inositol every night because he said it helps his brain shut off
Yep.
in a good
See?
way.
In a good way. I also think a lot of kids of all ages are poor eaters, and low zinc is associated with restrictive eating and poor eating. So zinc is great. You always take it with food, because if your kid doesn't, they're going to get nauseous and they'll refuse to take it. So I think zinc is that, and a really good probiotic, a broad spectrum probiotic. Sometimes, I mean, people like my autistics, I put them on a good probiotic, bam, they'll call me. They'll be like, this probiotic's doing something, like not even just pooping, but just helping them be more regulated and alert, because stress lowers your good bacteria in your gut, and we need it for
Particular
neurotransmitters.
strain that you use with your autistic
Um,
patient?
I love designs. I like two brands. I like Designs for Health, that Pro Med Bio, that's like there's
Mhm.
100 billion. I
Yep.
think I said it wrong. And Claire Labs with a K
Yep.
makes some really good ones that's refrigerated. Um, those tend to be what I feel like are good broad spectrum, good in general. A lot of my people get poop tests so we can see what is going on. I don't think you need a poop test. I think you just get yourself a good broad spectrum. I am working on a probiotic for the brain,
I
um,
love it.
and to help mental health, but there are some good ones on the market for sure. Is there for you? Do you have certain brands that you like?
Yeah, I mean, I definitely like the ProBiomed,
Yeah.
the 50 or the 100. I
Hmm.
do like Megaspore, so a spore based. So there's soil based and spore based.
Yeah.
Megaspore is great unless you are prone to constipation, and then it might make you more constipated, which is a whole separate issue. And then, I do like Clara Labs, and it really depends, because for me, it's always like, what do you need?
What do you
And so
need? Are you
that's,
struggling with
yes,
detox?
right.
Are you struggling with this?
Yeah.
Right? For sure.
Yeah. But
Yeah.
I think even before I think about formal probiotics, which there's absolutely a place for them, I'm always thinking about probiotic rich foods, because those are equally important. So fermented veggies, I can usually get everyone to do those.
Absolutely.
Yogurt, like a high quality yogurt. Those are certainly helpful. If people tolerate dairy, like kefir, things like that, I think can be very helpful, because most of us need more beneficial bacteria in our gut
Totally.
microbiome. So I do
Yeah.
think those are all really super helpful. We're both so fortunate that we have, very open, honest, relationships. Even though I have boys, I tell them all the time, my husband and I have very close relationships, but obviously a lot of our children's behavior is a reflection of how their parents kind of manage and mitigate stress. And one thing that I know has been particularly helpful for my kids is, I have one swimmer and one football player, and not being as physically active for both of them was a bit of a shock, because I had one kid who's used to being in the pool 12 to 15 hours a week and all of a
Right.
sudden wasn't for months on end. And, obviously the gyms were closed. And so one thing that I know has been particularly beneficial, and I'm sure you probably would agree, is physical activity. So making sure, much like when my kids were little, like real little, like toddlers, I say if they fell asleep really fast at night, I knew I did my job well because they got enough exercise. And so it's really no different with older children, just making sure that they're moving their bodies every day. Sometimes my kids are forced to walk the dogs. Oh my gosh, there's such a big issue with walking the dogs every once in a while. But I always tell them, like, our bodies are conditioned to move. It's really important that we're doing that every day. And I think that, the physical activity piece we know has a lot of benefits for brain health. And we were actually talking about this prior to recording. Can you touch on that a little bit? Because,
Yeah.
as we're kind of touching on beneficial things, and I've got a whole kind of idea of kind of weaving in all these different topics I want to discuss with you, but so those are signs of things we need to look out for as parents. And then let's talk about some of the beneficial things we can do that, irrespective of where you live or what kind of environment you're in, you
Absolutely.
can do for your child's mental health benefits.
Well, and let's just piggyback on exercise, right? So, when kids aren't exercised, I like to think about, yes, we should think about what's happening physically, right? They're not getting the endorphins released.
Mhm.
Their body's not doing all the things that it's supposed to do, detoxification, lymphatic drainage, muscle building, right? But, and we know through research that even one 30-minute of 30 minutes of moderate exercise, one improves your performance on cognitive tests.
Mhm.
So we know that cognitively, because kids in the pandemic, their parents, and we're noticing this, problems with focus, problems with motivation, right? So your frontal lobes start working more appropriately. You do three 30-minute 30 minutes of moderate exercise 3 times a week. If you have ADHD, your symptoms decrease by 40%, just
Wow.
3 times a week. So much goes on, but you're missing socialization without exercise. You're reducing your hands-on activities, right? Especially when we're replacing with technology. And exercise helps us to regulate our entire nervous system. It gives us balance so that we're able to handle stressors. So when we make it a priority, right, this is a mental health, this is a stress inoculator, exercising. But when we make it a family activity, right, it gives us an opportunity. Like when I like to talk about how to talk to kids about mental health, and let's tie it into exercise. So I talk about the 4 C's of conversing about mental health, and it's connection, comforting, communicating with your kids, and being conscientious, right, of what you're seeing. And so connection, particularly with teenagers, guys, comes through activities, right? When the body is moving, the mouth moves. If you're going to jump in at your kid and treat it like the Spanish Inquisition, they're going to repel you, right? But if you're out there walking or doing something fun, you're just more likely to have that, communication. And, it's a place of comfort. It's just a routine. It becomes a family value. And, your kids may bristle with you to get their butts out there like your dog, but that's
Mhm.
okay.
Yeah. I'm like,
And
tough.
just be like, guess what? You want to have some computer time? Get your butt out there, right? Like, this is our time. And if you haven't already got a sense, I'm super playful. Part of the Hodge motto is to have fun and be playful, and it's such a great diffuser. Like, even when my younger kid Giancarlo, who's so easy, I see him getting difficult, and I was like, are you gonna Hulk on me? It's like Bruce Banner, and he will start cracking up, and then the words come, and then he's able to talk to me about what it is. And it's you just have to have that way, and I feel better, right? If I was like, hey, knock it off, I don't need to hear a snarky mouth, we just create these friction points. And so communication is super, super important. And please know, really, you can bring the fun back in your life, because I feel like nobody's having any fun, and it should come in these little moments, right? And then again, just being super conscientious about what you see. So that's where it all starts. And it also starts, how can parents really help their kids with their mental health? Well, the number one predictor of kids' mental health in their life is maternal mental health. So, not trying to make you feel bad, because we shouldn't feel bad. We're terrible to ourselves. We tell each other, we tell, what we say to ourselves is like 1,000 times worse than any other person,
Mhm.
right, Cynthia? You know,
Yes.
and
100%.
100%. So put your oxygen mask on, give yourself some darn self-care, because you're going to be a better friend, you're going to be a better partner, you're going to be a better employee, and you're going to be a better parent. And your kids get to they're seeing you role modeling, they're learning. So our kids learn more from what we say than what we do. I mean, not from what we do than what we say, right? And so, yes, they listen to us, but if we're incongruent in what we're saying from our actions, which can easily happen when we're stressed out. So prioritize these lifestyle components, as Cynthia always talks about, healthy eating. My kids, they understand, like, my kids will ask random questions like, what nutrient is in here? Because it's just part of that conversation.
Mhm.
If they say to me, oh, I'm feeling really tired, I'm like, well, what would be a good food choice for you right now? Like, and they just start empowering them. I don't say you better eat this. I put it back on them. And so we know that good mental health, right? So we have maternal mental health, we have physical activity, but we want to develop, in order to be a successful kid at school, at home, and in life, they've got to really have inner confidence and resilience, right? And so it's those little opportunities that create that, right? And
Mhm.
so you have to you got to parent your kid to be autonomous. I talk about, I have something called the CHAMP technique for raising kids. And the A in CHAMP is parenting to be autonomous, because we want our kids, as tough as these moments are right for now, we want to provide comfort, we want to connect with them, we want to communicate, we want to do all those things. You also have to help your kids develop these coping skills, and it's through these moments that really help to build it. And it's super powerful. You're not going to develop a whole new parenting strategy. You're just going to shift your language, because I don't want parents to feel any more overwhelmed than they are. Instead, I want you to flip that dialogue and think about, wow, I actually have so many things that I can do. And all it takes is these little shifts that can create these massive, beautiful changes in my kids' mental health, and my family mental health can be better.
There's so much to unpack there. And one thing that you touched on, I was talking to John Levy, who's this incredible, neuroscience biological researcher. And we were having a conversation about fragility and how, what are some of the predictors of fragility, and how, stressors at certain points in our lives can actually be really beneficial. And he was indicating that, teenagers and young adults, that's a time in their lives, if they have a particularly stressful situation, can actually give them the opportunity to get stronger. And so this whole fragility model is something that I'm a huge advocate of, that we want to foster relationships and foster children that are able to respond and kind of, instead of having a trauma like being in the pandemic and having it turn into a lifelong issue, having them come out and develop um, strategies and abilities that maybe they didn't have before. I always think about the World War II generation. That was probably one of my favorite generations to take care of as a nurse practitioner. And I always found that they were so resilient because they went through so much. And so they just kind of stood up, and instead of being fragile, they were anti-fragile. And so I wonder, what kind of research is going to come out of the pandemic in terms of the impact on the mental health and physical health of our children. And hopefully, for those of us that are, trying our darndest to, be as open and honest and forthcoming, whatever's age appropriate for our children, that we can embody them with the strategies and the ability to be able to come out of this stronger. Like I tell my boys all the time, I'm like, listen, we're getting into a point that things are starting to get back to some degree of normalcy. Like we're actually flying to Montana next week. I have a speaking event, and we're taking the whole family because it's such a beautiful part of the country. It's the first time all of us have been on a plane. My kids haven't been on a plane since 2019. I haven't been on a plane since March of 2020. Same with my husband. And so, can we touch on the fragility piece? Because I think that's, you're definitely navigating around that, but I find it utterly fascinating. And it's much like a hormetic stressor. A little bit of stress is good. Too much is too much and can be non-beneficial to an organism. But let's touch on that, because I think that that particular item is of tremendous interest to me when I'm thinking about our children and the net impact on the entire population.
And let's talk about, we talk about the World War II generation, or people that have gone through a really rough time. My dad was a child in Italy in World War II, and was very, very, very poor. Like he was the kid that didn't have shoes. Okay. And they would throw bombs in the tunnels where they lived, and he'd have to run. And he tells all these stories. My dad is like me. We're just like stress slayers. We're like, this is what we do. Cynthia knows me. So I'm like, I'm always like, okay, what's the benefit out of this? I process it and I move on. But in mental health, there are protective factors and risk factors, and this ties into what we're talking about. And so one of the biggest protective factors in mental health is having coping skills. It's the basis of resilience. And I talk a lot about something called a resiliency mindset. And when we talk about resiliency, we often don't talk about, it's about managing stress. And so there's 3 parts. It's how you view, manage, and recover stress. And kids today, Cynthia, my kids who are struggling the most, right? And I think about mental health issues as a dysregulation of the nervous system. Not that there isn't clinical anxiety and OCD and depression, which is holy moly isn't on the uptick, but it's about having dysregulated areas within your brain, but also in our brain's communication system. And I get to see this in QEEG brain maps, so we could talk about that. But kids are dysregulated very easily, and they can show breakdowns in one of those 3 areas. And when people work with me, I help them to understand that. And then we can measure progress based on, well, okay, is the recovery getting better, right? Because it's about having the braking system, right? So our emotional brain, we often only think about the limbic system, but it also involves the braking system of the frontal lobes. And something that hardly anybody talk about, your occipital region, the back region of your brain. It's your emotional e-brake back there. So no matter what happens, if your brakes aren't working, this area should flood. And when I look at people's brains in these brain scans, what happens is I'm seeing that people don't have resources. They don't have a braking system, and then they don't have an e-brake that would flood you and regulate your nervous system. A good, happy brain wave comes out called alpha. They're like literally just in constant activation. And so when we talk about fragility, right? When the best people, I talk about myself and my dad being stress slayers, I just don't view stress in the same way. And it starts with that. So my body, from a neurological perspective, I don't start the cascade of everything that goes on, your hormones, your neurotransmitters activating, because I'm like, I got a speeding ticket. It was long overdue, and so right, happened in the pandemic, true story. And this is when we need to, how can we change this for our kids? How can I get my kid to be a stress slayer? Well, we need to role model it, number one. Okay. And trust me, you got plenty of opportunities every hour on the hour, from something falling out of your fridge to your cat throwing up on the floor, whatever. There's plenty of opportunities to show your kids how to. We're not ignoring stress. We're not pretending it doesn't exist. And even when you're super stressed out, you have to be like, kids, holy guacamole, super stressed out. last week we're at our friend's house and I was cracking up because my teenager, right? Everybody knows me, knows I got a potty mouth. I'm the only person in my family with a potty mouth. My parents didn't have potty mouth. And my teenager was saying, oh, you hear mom swear once, no big deal. You hear her swear twice, you better run. And I was like, that's pretty true, Max. But it doesn't happen that much, right? So how do we build this? So we want to create these moments for teaching coping skills. I recently, my easy kid, John Carlo, he does not forget things. Okay. He's the guy that reminds me. I have a damn good memory. He reminds me, don't forget, you got to do this in the morning and bum, bum, bum. So in 1 week, he had never, ever done this. He forgot his computer for school, and he goes to super cool science school and he does coding and programming. And he's been able to do this since he's like 6 years old. And so I said, hey, your cousin can go pick it up and bring it to you. By the way, his school is like 35 minutes from my house. So on the highway. So it's far. And so I said, hey, it's a one-time deal. Don't forget it again. Okay. Cause your cousin can do it. He's like, oh, thank goodness. The same week he forgot it again. And so he's so funny because he knew, and he was like, what time's your first meeting, Mom? And I said, oh, my first meeting's at 11. He goes, oh, I forgot my computer and you have plenty of time to go and pick it up. So I was like, hey, here's the scoop. I'm not going to get it. I told you it was a one-time deal. And he goes, you don't have a meeting till 11. And I said, I'm busy. And we talked about it. He was mad. He told me he hated me, Cynthia. I mean, this kid, he doesn't normally do that, right? And I was like, honey, I understand you're mad. And so, and I was like, look, think of it this way. You've never forgotten it before. Okay. And then my opportunity was, even though he was mad, I was like, what else could you do? Right? I didn't say, oh, poor baby. I didn't say, I was like, wow, that's really nice that you decided to tell me you hate me. And again, we're very playful and we laugh, but I used as an opportunity to do that. So he wound up pulling himself together. I didn't try to overparent. I didn't try to overcomfort him. And I didn't even have to go the first time. But again, you got a super easy kid that doesn't ask for something every once in a while. You just got to do something extra, right? But if I had run home, what would I have taught him? Right? Oh, he made himself a checklist, Cynthia. So he never forgot his computer ever again on a Friday. I didn't even have to ask him. He developed his own coping mechanism to do that on his own, and he figured it out. He's not going to forget it. He's going to take that lesson, and I didn't have to bubble wrap him. And so that's really what you need to do. You need to teach kids those coping skills. So your kid gets upset and they're crying, and you're like, wait a second, the last time this happened, you did what? I don't remember. And you're like, hold on a second, take a breath, think about it. I did this. Okay. What do you think you should do? Right? You don't say, let me go and do this for you. You want your kids to find their internal resources. I mean, that's one of the biggest shifts that I've seen in this 30 years of working with kids and families, is we are over-parenting our kids. And what's happening is stress tolerance is like, I've never seen brighter kids, great grades, people, grades don't define mental health, not be able to cope with little disappointments. And these little disappointments, everybody, are the practice for the big disappointments in life. Your girlfriend breaking up with you. You didn't get the job you wanted. You didn't get matched to the MD program you wanted to be. Whatever, you know what I mean? A hurricane hit you at the wedding. You know, I mean, big things. That's how we get ready for those things. That's how I always say, I'm the captain you want on your ship when it's going down. Because when it goes down, I am like in my zone. I am really like a slayer of stress. I'm like, okay, what do I got to do? I go into a heightened mode of being able to problem solve. You know, that came from my parents parented me very independently, and they let me make failures. So I think that's really, really important. We talk about fragility. We're really talking about no stress tolerance.
Yep. No. And it's interesting because when I was speaking with John, it really, oftentimes when I've connected with a podcast guest, I will kind of really reflect on our conversation, because I really value, this is one of my favorite things to do, is to podcast and connect with other experts and be able to share your knowledge and others' knowledge with the podcast listeners. But the fragility piece really stuck with me. And much to your point, I was an ER nurse in inner city Baltimore. I worked in cardiology as an NP for 16 years. I was always that very calm, cool, collected person. And I generally deal very, very well with stress. And I've had two instances with each one of my children over the last couple months where I had to let them sit with their mistake. And I recall, my parents did a lot of things well, and then they did some things that were not so well, but our
They
parents do the
all
best
do,
they can.
right?
Exactly. Our parents do the best we can. But one thing my parents did, my mother in particular, better than a lot of other families and children I was friends with at the time, was my mother would say things to me like, I could make it easier for you, but you wouldn't learn anything. And I thought she was like the meanest, most awful person. But what it taught me was, ultimately, I'm responsible for myself. And I had one instance where a kiddo did not do as well as he wanted to on an exam. And I, kind of said, did you connect with your teacher to find out what you got wrong? And, he was starting to head down the direction, well, can you reach out to my teacher and can you do this? And I said, no. I mean, it sounds like you made some honest mistakes and you went from an A+ to an A in algebra, and the world will go on. And this is just one semester, and this is not the end of the world. Cause he was in his head thinking about the long-term impact. Does this mean
Right.
I won't be able to get into that magnet high school? Does this mean this? And then another day, my older son, he's 15 years old. He's smart. He's responsible. Well, he just decided, because we're going to be moving, that he didn't need to stay on this list for his football team. Well, we showed up very early in the morning for practice, and there was no conditioning practice. And it meant that, both parents had gotten up early. We had gotten in the car, and I just said, this is a one and done. So you are now going to be part of that email list until we move, because if this happens again, there's going to be some type of a repercussion, because you're not respecting my time and you're
Right.
not respecting your dad's time. And so, he really understood, and he came home and immediately reassigned himself to that. But, allowing our children to be a little bit more independent, I think
Yes.
this helicopter parenting, that I'm sure is done with good intentions, is going to make our children not very resilient. They are not going to be able to deal with disappointment, and disappointment is a part of life. Like I know we've had private conversations where I've said, I'm so glad that X happened to me, because what came of that is I changed paths, and I didn't go to law school. I ended up doing something completely different. And so I think it really leads us to the path we're meant to be on, but we have to look at those as teachable moments and not necessarily as a negative thing. It's like, yeah, that sucked. I didn't go to the college I wanted to, or maybe that relationship didn't work out, or some other, extraneous. We've been, largely stuck in our homes for 15 or 16 months, but it's how we frame those experiences. It's how we look at them that allows us to kind of look forward. And I love that you're a part of my tribe, and you are another person that is calm in the storm, because we need people like this, just like we need people who are completely the opposite. It's how we balance out society. If we were all that way, then we probably wouldn't get a lot done, because we like to tell people, like, this is what you need to do next.
But
That's
it's
part of our
about,
personalities.
it's that, when we have uncomfortable situations, right? Our anchor is our body, and our body cues us to these
Mhm.
different sensations, right? We often in therapy over focus on feelings. I'm not
Mhm.
saying feelings aren't important, but our body gives us a cueing. I do a lot of what's called somatic therapy, and it's about teaching people to reconnect to their body, whether they are under stress or have had a traumatic event, and we want to disconnect, right? So when kids don't have stressful experiences, they don't recognize those feelings and sensations and thoughts that come through. And our parents are so well intending, Cynthia. They really want their kids to have the best, right? Like my immigrant parents wanted me to have the best. Like for them, it was education, right? They never thought that I wasn't capable, so they let us be super, super crazy independent. And they let us do all kinds of things, like jump on the train in the 80s to go into the city in New
Yeah.
York when it was full of criminals, but they knew they raised kids that had great common sense and they knew we were in a pack. And guess what? Nothing happened, right? So they gave us plenty of opportunities. But when we teach kids, hey, listen, that's what grief feels like. Hey, that's what depression, sadness feels like. They're able to recognize it, process, and address it instead of being overwhelmed by it because they've never experienced it. There's so many parts about experiencing failure. Just like you said, your son, he made a mistake. You were like, hey, you didn't get into screaming match with him. You were like, here's the deal. Now it's on you. And the great part is that's developmentally appropriate. He can manage his own email. You can be CC'd on it, and he's going to have to develop some resources to do it on his own. And that's going to serve him beautifully in life. He wasn't stressed out by it. He found a way to do it, and I can say that we grew up in the 80s. Our parents weren't all over us about these kind of things. My parents were like, oh, you got a test today? Oh, okay. You studied? Okay. Yeah, sure. So I don't even think they asked me if I studied. They just assumed I was going to do the right thing. Maybe they should have been checking Tony and Philomena because I read a lot of books when I was in class that had nothing to do with class. I did okay. But seriously, we do need to give our kids these chances of failure because it's so important for their mental health. And if your kids are so dysregulated, when you think about that resiliency mindset, how you view, manage, and cope with stress, if you have kids that are recover from stress, if you kids that just don't recover, they literally are tantruming, they're stuck, they're angry, they're resentful, and it goes on for inappropriate time. Let me tell you, your kid 100% has a dysregulated nervous system, and they need to think about what are things clinically that I can do. Is this, do we need to do, we should be doing things every day like breath work and meditation and yoga. And then you could do more advanced things like biofeedback and neurofeedback. You can do other things to help your child that has nothing to do with a pill, because a pill is not going to fix things. And the basis of my work is regulating the nervous system, coming in with new learning. That is 100% why people come from all over the world, because it's about teaching you another way to cope, to manage it, and giving you that internal confidence. Because when we always look for external resources, it's just a Band-Aid. You'll never really get better. And in fact, you go from Band-Aiding one situation to another. And, as a mom, I just want my kids to be happy, right? And to be kind, nice people, just like Max saved me that last cup, saved me my mochaccino cupcake, which I'm going to get back to him, by the way. So when I get home, because he was a teenager, he's still sleeping this morning,
So so much value in what you just said, but you did talk a little bit about some of these biohacking, and as anyone that's a listener, this is an area of interest of mine. It's something I touch on with most of our guests. Let's unpack what is neurofeedback, biofeedback, and what does it do for our brains? Because I think this is fascinating. And I'll just interject to say that many years ago, when I was a new nurse and I worked as an ER nurse in Baltimore, some of the most interesting characters were the neurologists. And it was largely because they were very cerebral, but we really understand such a little amount of what goes on with our brains that I find this is now fast forward 20 some odd years later, and now we know so much more. So I'd love for you to touch on this because I think this is particularly relevant and really valuable.
Yeah. So this is my 30th year in mental health. And
hard to believe. You're so youthful.
Well, thank you. It's good skincare, as Cynthia has taught me. It's a lot of drinking of water. And I was raised holistically. Like, we always think Italians eat lasagna.
Crunchy before we knew what crunchy was.
Yeah. I'd actually have to hide that I was crunchy. The chicks on my bus stop were like, you eat what? And you do what?
Did you eat organ meat as a child?
Of course we did.
Well, no, I tell people, I'm like, I thought my mom was so weird, but we had like organ meat and
Oh my God, my mom makes the best turkey stuffing with the organ meat. It's like, Oh, it's really, really good. And, we grew up with 2 to 3 vegetables at every meal.
Yeah.
Pasta wasn't something we had every night. We ate a lot of, Italians call it verdure, a lot of greens, a lot of things like that, and always had a massive, massive garden. My parents have a 2,400 square foot garden.
What?
They have to have somebody come and help them.
Of course they do. That's
Yeah.
massive. Oh my God.
It's a lot of good stuff. But so let's talk about neuro and biofeedback, because you got me all excited. I'm such a geek on this. So for, I've only done integrative mental health because when you go to the research, people, it's not medication that comes up. It's what is called integrative. And so, in my book, It's Going to Be Okay, I dive into these 8 pillars of mental health, and parenting is one part, and as well as these brain-based things. And so people don't know about neurofeedback. It's 50 years old. Biofeedback is probably, I think, 70 or 80 years old. Tens of thousands of research studies, 3,000 peer-reviewed studies with neurofeedback. These tools are used for both to address clinical conditions, you name it. If I haven't talked about it, please know that it's there. Headaches, pain, drug addiction. I do a lot of brain injury stuff, and as well as for optimization. Like sometimes I just work with executives. All the major athletes do it. The space guys are all mandated to do it before they go to space. It's pretty incredible because, if anybody who knows me, I get a lot of shit done. And it's really because I eat incredibly well, but also I do a lot of neurofeedback, and it takes you to a higher level of consciousness. But when we talk about, what's the difference? So biofeedback is learning how to take control of an autonomic function. So your breath, your heart rate, your skin temperature, your muscle. Why do you mostly do it? You mostly do it for stress management and pain, as well as to gain muscle control for specific things like having bladder floor issues and a whole host of things. It's an awesome thing. The devices are very inexpensive. It's super accessible. Can't say enough good things about it. And you can do with any age. I started doing heart rate variability training with my little guy when he was 2. Okay. So it's super, super easy. Now, neurofeedback is training the subconscious to get into a regulated state. So if you heard me before, brain dysregulation shows up along this continuum to internalizing to externalizing behaviors, whether you want to address it at a behavioral level or it's a clinical condition. You just about can reduce or reverse pretty any clinical symptom with neurofeedback. And there's thousands of research studies to substantiate. It's always a piece in the holistic component. You must incorporate lifestyle changes. Remember, the basis of my work, regulating the nervous system typically with brain-based technologies, but other things too, because lots of free things to do, and then new learning. So you still have to come in with new learning. So for most people, the process starts with what I do. So I either do, if you're local to me, you drive in, you do something called a QEEG brain map. Or if you're in another country, because we do remote neurofeedback too. We have clients in like Asia, we send you the equipment. We do a brain check. We look at certain areas of the brain because I can read raw EEG data. So it gives you a visual representation of the brain, and then I'm able to make protocols on it. And so what the heck is neurofeedback? What does it look like? Super, super, super simple concept. Nothing comes through the wires. You're hooked to a computer. And your subconscious brain has to start working and regulating the brain. And in 2 to 3 seconds from the first time you get hooked up, neurofeedback will start regulating your brain because it wants this reinforcement. What we do is we use technology. It plays movies, and you get visual and auditory feedback, and your subconscious. By the way, the number 1 movie in the office is Back to the Future, regardless of age. And so you get to see Doc Brown and Marty McFly, doing the DeLorean, and your subconscious brain is like, okay, I want this reinforcement. It's just exercise for the brain to take you out of a dysregulated state, regardless of clinical condition, regardless if there's no clinical condition, and you just want to optimize your brain. And the thing about neurofeedback and biofeedback, just like working out. It's going to take some time. You don't do one session and you're buff at the gym. And so most people are doing at least 20 sessions. If you've tried neurofeedback and you only did 5 or 10 and you're like, I didn't notice anything, it's because homeostasis, your brain does not want to change its set point. Same thing about weight. You really have to start mixing it up. So it's pleasant, it's safe. There's 50 years of research to show that there's not one negative component to it. It is so ridiculously effective. When people come to me, they're often like, I'm so afraid. How could this natural thing work? And I'm like, well, you've tried 8 medications and it didn't work. So this has the research. Let's do it. Let's give it a chance. And then they'll do like 20 sessions and they meet with me and they're like, holy cow, this works so great. Why didn't I know about this? And I'm like, this is why Dr. Rowe does what she does and gets out there, because there's no need, I'm not an anti-medication. I just am an anti-overuse of medication. And 70% of psychiatric medications with kids under 18 are used off-label, which means there's no research to substantiate their efficacy for that thing. So we need to be concerned. So super powerful. And really, what does it do when you get in a regulated state? Your brain is working. So I can change the function over structures and the neural networks. And what's awesome about the neural networks are the super highways between sites. And the most famous person you could think of who had the best neural network is Einstein. So he had 400 times the neural networks in one area over the corpus callosum. I don't want to get too geeky on you. And that is the superhighway connector of the brain. And he had a genetic defect there that allowed him to process that. So I do a lot of work on the neural networks, and anybody who's really connected to themselves, particularly my adults, are like, I can just process so much faster. And I'm like, oh, trust me, I know, it's really pretty cool. So if for those biohackers or you're like, holy moly, I'm so stressed out. I just can't get a hold. The nutrition's not doing it for me. The exercise isn't doing it for me. First of all, don't abandon those things. Those are the foundational components of the nervous system, right? Which includes your brain. And you're going to help with neuroplasticity. You're going to help with, those are clinically proven to reduce every clinical condition you could think of, but the top ones, anxiety, depression, and OCD. So, but neurofeedback, it's pleasant, it's easy. It just takes a commitment. You're going to need to do it 2 or 3 times a week. And changes are lasting. The research studies as far as 10 years out show that most people sustain the brain changes. And not only do they sustain them, the brain continues to improve and change on its own, which is pretty cool. So every day we help people lose clinical diagnoses. I know nobody wants to talk about that because they get all upset when I say reduce and reverse mental health issues and conditions. Everybody's brain is different. And some people will and some people won't. But when you adopt and utilize evidence-based approaches that are totally grounded in neuroscience, there's no way not to get better. There is no way. The only limiter in that is the person's belief system that they can't.
I think that's really incredible. And ironically enough, I had my first neurofeedback session a few weeks ago. There's a local friend who just started this business. And I had one session. And I remember I went home and I had like the best sleep ever. And I said, could that have been from one session? And she said, I do have people that report that they have this like relaxation factor. And so if you're mastering your brain, if you're facilitating, support of the autonomic nervous system, more parasympathetic than sympathetic, more rest and repose as opposed to fight or flight, that really makes sense. Now, I want to be super respectful of your time. And obviously I'm going to have to bring you back because there were so many other rabbit holes we could have dove down. And, some of the things that I want to make sure I quickly touch on that people were asking about. Number one, I had a couple followers' questions. Number one was, how do I limit screen time in the pandemic and social distancing? So that was the first question. I'm sure you probably have like a canned response because you probably get asked this a lot.
So my answer is this: use technology to limit. So
Mhm.
we use a device called Grapheon. There's all different kinds. And basically, again, to try to empower our kids to be autonomous, our kids, we tell them this is the amount of time they have, a
Mhm.
Wi-Fi time.
Mhm.
And that is all they get. They have to budget and manage it. And once it's over, it's over. And the only way that my kids can get extra time is if they do physical activities. In our house, we're making our kids do all the labor around the house. So they're moving like wood piles and things
Mhm.
like that. And they just do it. They're like, hey, mom, I ran out of Wi-Fi time. What if I get all the garbage and I do this and blah, blah, blah. I'm like, sounds great. Boom. It stopped all the friction because everybody I want to talk to. I just did a big training for a corporation. And this is what the CEO wanted to talk to me about, like how to stop this with their kid.
Yeah.
You know what I mean? So I think that's the number one thing you can do, and really insist that I'm more worried about what they're missing
Mhm.
by being on too much technology. Technology is here. You got to get them moving, exercise way, but that's my number one tip.
Okay. So out of curiosity, your teenager, how much time does he get? Is it per day or per week?
It's per day. I want
Okay.
to say he gets like 5 hours. So he's got a
Okay.
long list of things he's got to do. And he just honestly just does them now.
Okay.
Like it's rare that we're getting in any kind of argument, which is,
Okay.
you know what
Yeah.
I mean?
That's
So
a beautiful thing.
it's a beautiful thing. And I'm not saying that's the right amount. You might be shocked by that amount. The other question is, what is the right amount? Well, prior to the pandemic, they kept saying 2 hours, 2 hours, 2 hours. The average that people are spending, teens, 13 to 18-year-old in 2019 is 7.22 hours.
Mhm. Yep. That makes sense.
That's the average kids are spending every day.
And that's average. So you think about, 50%, roughly
Yeah.
50% are spending more time than
Yeah.
that. And that makes complete sense. Now I'm going to have to bring you back to address this other question, but one quick question about the net impact of if someone has contracted the virus, they were
Yeah.
exposed to COVID, developed COVID, even if they had mild symptoms, what are some of the big signs for you of the long-term effects? Like if someone cleared the virus, they felt
Yeah.
bad for a week or two,
Yeah.
what would be things that for you would be setting off kind of alarm bells that they require further evaluation? So these long haul COVID survivors.
Yeah. So such a great question, because I've been talking about this for months. And I am seeing cognitive and psychiatric
Mhm.
issues resulting post COVID. And I specialize in something called PANS and PANDAS and autoimmune encephalopathy. I won't go into that's a whole other conversation. So it's when you have an infectious or
Mhm.
toxin trigger that does a sudden onset of a psychiatric, a cognitive issue. And the P is supposed to stand for pediatric. We now are not. We're now
Mhm.
opening that up to adults.
Wow.
So what do you need to look for? So all of a sudden your kid looks like they're ADHD.
Mhm.
I've had kids with psychosis after,
Oh.
and this is happening to adults too. So please, know that. So you want to look for a shift that doesn't seem to fit. And COVID can be a slow decline. Like every day they seem to be more unfocused. The reading is really off. If you see that change, don't trust your gut and, look for ways to support that. So, I like to talk about different supplements that can help, things like Bakaba, but you want to make sure it's appropriately
Mhm.
detoxed out of the body. I won't go into every detail. I talk a lot about it in my book. That's a whole chapter. Detoxification is a pillar of mental health, but you want to make sure that you're up moving. You're using things like parsley and cilantro and other tools in your daily to help detox. This is just good stuff. And then I do a lot of, obviously, neurofeedback and PEMF. That's a whole other topic. I'm totally a PMF junkie. And to help to get the nervous system back online, because no healing can occur if your nervous system is in a hyper stress activated state. And I specialize so much in infectious disease. That's probably the top reason why people come to me, because they have psychiatric issues and they're working with amazing providers, but they can't get better. It's because the nervous system is stuck on. So if you see signs and symptoms, don't think all of a sudden your kid now has depression when there's no history. They can be depressed, but the result, it can be from a medical issue. Find somebody who can help support you. Neurofeedback providers are all over the world. You can go to bcia.org to find a certified person. Like I said, I work remotely with people as well, but you want to make sure that you are helping their brain to get back online, because from a brain perspective, what COVID does, it looks just like Epstein-Barr, by the way, on a brain map. It comes in and shuts everything off, Cynthia. So I'll have a brain map and literally there's no connectivity. There's no processing working. It's like, I always try to explain to the parents and the adults that come in that it's like your brain is constantly on Waze. And there's no direct route. And so it's very, very stressful and draining from a processing perspective, which is why you look like you're ADHD, or something's taking you 5 hours when it used to take you a half an hour. So when you see it, believe it and take action on it.
Well, Dr. Rowe, I would imagine with our modern day lifestyles, there's a lot about how we interact with our environment that can actually deplete myo-inositol. And for you, do you see low magnesium being an issue for a lot of your patients? So you're a clinical psychologist, you work with a variety of children and men and women. Do you find that magnesium or low magnesium can actually exacerbate our need for myo-inositol?
Yeah. So, and please know, myo-inositol and inositol are used interchangeably, and it's the same thing. So I don't want to confuse anybody. I'm so used to always talking about inositol, so bear with me. But first, magnesium, the most used nutrient in the body, is just most commonly depleted in basically every single individual I see. So a lot of time I work with families and they bring a young adult, a teenager, a child to me. And that is the identified person who's really struggling. It could be anxiety or depression or OCD, whatever it is. And through testing, we often find that they have low magnesium. But then when we go to mama and papa, the whole family is low in magnesium because of stress. I was just talking about this with my husband today, because he was like, how many I'm working on a magnesium product, and he's like, how many magnesiums are you gonna be selling to people? And I'm like, the whole family needs it. I was like, you take it and our entire family of 4 takes it, because we need it. And there's a connection to this very important nutrient and inositol for brain health. And we step out more specifically, these nutrients tend to be low in individuals with myo-inositol, in particular with anxiety, OCD, depression, bipolar, panic attacks, agoraphobia, eating disorders. And I'm putting PCOS in there because PCS tends to be a root cause of some of these other things. And, it's important to make that connection between, low inositol levels, which they say are rare, but I don't believe that, because we know through research, when you actually supplement with these, with myo-inositol and magnesium, these conditions, the symptoms improve.
And I think it's so important to understand this interrelationship with our environment, the foods we're consuming, et cetera, and the net impact on low magnesium exacerbating this need for inositol. And it's interesting, when I was looking at the research, magnesium is actually required for biosynthesis of inositol. In the same vein, when we talk about what depletes inositol stores in the body, it's our hyper-processed, hyper-palatable nutrition. It's low salt intake. And it's not, when we talk about low salt intake, we know sodium is very important for a lot of physiologic processes, but these low sodium diets, how many times did I tell my patients in cardiology that it was important that they consume these nearly impalatable diets with no salt, no fat, and encourage them to eat cardboard essentially, and that they're supposed to be satiated, but also insulin resistance plays a role. We know that the aging process, just even antibiotics. So we know that antibiotics have a huge net impact on the body. And as someone who, was recently on antibiotics because I picked up salmonella during travel, and I came home being very symptomatic, there's a lot that you have to do to kind of counteract being on antibiotics. And by no means am I saying that there's not a place for antibiotics, but understanding that this in and of itself can also create these imbalances. And then caffeine use. How many of us are addicted to caffeine and we consume way too much of it? That also can deplete the inositol levels in our bodies as well.
Yeah. And, I think, we started this conversation about magnesium and you talked about this. So magnesium is the most used nutrient because over 300 processes require it as a cofactor. So it's the helper, right? And when magnesium is so low for so many people because of stress and these things that you're talking about, and, you can get an antibiotic, script for just about anything. It's actually shocking how easily they want to hand it out when you go to the doctor. And, I recently had pneumonia and I was like, do I really have to take an antibiotic? And I'm going to try the herbals. And then finally I was like, I don't got time for this. I've had RSV. I've got to do it, And I said, just give me the lowest amount, the shortest dose, and I'm going to use my herbals. And that's what I did. But you do have to protect yourself for the depletion of the microbiome, and everything is connected. I mean, I think this conversation, I love to get into the weeds of things, but ultimately in the end, every little thing that you do can be a helper or a herder. And there are times, just like Dr. Rowe had to get on some antibiotics, and yes, my pneumonia went away and I caught it like really early, because I know myself and I know my body, but I then purposely countered, and making sure that I had extra nutrients and of course probiotics, at the right time away from my antibiotics to repair my body. And when we talk about low levels of inositol, we may not understand some of these symptoms that we see because they're sort of vague. And they can be attributed to a lot of things. So like fatigue, having some mood issues, constipation, muscle weakness, or numbness, right? Certainly numbness is going to stand out because that's not really a typical thing that you would see. But fatigue and mood, hello, we're talking mostly to women here. This is like, we're in the hormone changing times, and it's really easy to struggle with those things at different points. And as I always say, if something is sticking around and it's not a temporary, like, oh, I'm tired this week because I decided to do X, Y, and Z or travel, you need to not ignore that.
Well, I think listening to our bodies is certainly really important. And in many ways, for those of us that are traditionally allopathic trained, we weren't trained to look at things like that. It was more symptomatology, not root cause. You kind of alluded to what can transpire when we take antibiotics and how it disrupts the gut microbiome and how taking, probiotics away from antibiotics can be helpful. But what is it that's unique about the gut microbiome that impacts our mood? I think this is a key kind of big concept to take away.
Yeah. And, you and I have talked about this before on our podcast, and we have a blog on this, but it is so important. So, there is a connection between our gut and our brain, and the vagus nerve is that connection. But I don't think people really understand. They see the Activia commercial, Cynthia, about the gut and how you need to do some probiotics. And you know what? People are doing the best they can. There's lots of ways. But why is that important? So number one, their neurotransmitters are created not just in the brain, but in the gut. And there's one very important neurotransmitter related to mood and attention and stress, and it's called serotonin, and it's almost exclusively created in our gut. And our gut can get disrupted by antibiotics, high stress levels, hormones. I mean, there's just a lot of things. And we do always have to counter, right? You're like, Dr. Rowe, you're telling me to do a million things. No, we have to try to do the simplest things and live as clean of a lifestyle and moderate our stress, And as my dad would say, this is easy with the mouth, Roseann. That's what Tony would say. But this is what we're doing here. This is what I do. This is what Cynthia does. And if you're listening, you want to do this too. That's why you're listening. And the payoff is huge. You feel better. Your energy's better. Your skin looks better. All these great things. And you're role modeling for your children. And I think that's super important. So the gut has to be protected and it has to be nurtured. And that connection, right? So these neurotransmitters and our vagus nerve, right, is that bidirectional pathway to the brain. So the brain influences the gut influences the brain. And there's a lot of positive things we can do to influence that by what we eat, having supplements, as well as moderating our stress are the 3 top things that you can really do to help keep your neurotransmitters in balance. It's not just psychiatric medication. I think that's what's so shocking to people. And please know your physician, your GP, they're doing the best they can. And we've gotten ourselves into this place where you go in and you're like, I'm feeling cranky. I'm this. They only know to write a script. They are not trained mental health people. They're not trained functional doctors. Unless you're going to a functional provider or a trained functional mental health provider, they're not going to look for root causes, as Cynthia said. And there's so much power in your own ability to control your mental health and your health. It's unbelievable. I think when parents come to me and families come to me, they're in shock. Right. Cynthia and I were just talking. I'm working with a little guy who is losing his autism diagnosis in a matter of months. Okay. And it's because they moved to a clean lifestyle. They're regulating his nervous system. And I believe he's going to fully lose his autism diagnosis as a young child that's under 5 years old. How amazing is that? Right? Like amazing. And they did it. I showed them what to do and they did it. They got the power, as I always like to say. And you can hear the 90s song. If I could sing, it would be going on. But how you support your systems is incredibly powerful in all of these clinical issues. And, Cynthia, our biggest issues that we're seeing with people today is anxiety and depression. I mean, those are our top issues, but I'm seeing a dramatic increase in OCD, panic attacks, more extreme things that really kind of shut down lives. And they don't happen overnight and they're not fixed overnight. But again, people have this control outside of psychiatric medication that's evidence-based.
Do you think that the increases in obsessive compulsive and anxiety and depression that you're seeing, do you think that's a direct relationship from the past 3 years, living through the pandemic, being separated from our loved ones, wearing masks? I mean, I think about, and my heart really goes out to parents with younger children in particular, because I have all boys. I can't even imagine trying to have kept a mask on a young child. And then they're losing the ability to look at facial expressions. And so they're just at a time where there's massive developmental, acceleration. And I would imagine as caregivers and parents, for so many people, just not being able to live their lives the way that they had been could contribute to a lot of mental health issues.
Yeah. So the answer is yes. Has the pandemic thrown fuel on the fire? Yes, but the fire was already burning. And, before the pandemic, we were seeing big increases in all age levels of mental health problems. There was a doubling of suicide rates that happened in 10 to 19-year-olds right before the pandemic. I mean, it's just terrible, right? And we're during the pandemic, we saw 70% of parents were reporting high levels of parenting stress, no surprise. But we also saw psychiatric medication with adults go from 1 in 6 to 1 in 4. So 1/4 of people are on psych meds. And Cynthia, people come to me all the time and they're like, I get it. I'm an Italian mother. You're Italian mother too. We put our kids before ourselves. So they come to me and they're like, we're going to do this for our kid and we're going to see. And then, but I want you to know I'm on Prozac. I mean, true story, happens every week. And I'm like, that's okay, but I'm going to challenge you because you're going to have to take care of yourself in order to create mental wellness today, but for all future generations. And you know, we get stuck in ways of doing things, but the level of stress for children and parents and all adults in this culture, in American culture in particular, but mental health problems across the globe are rising. Definitely the social isolation, the mask wearing, the fear, all just really, really today. Still, I get somebody every week who feels that they either didn't have a problem or they had a low level problem that just completely spiraled out of control due to the pandemic and the isolation that they felt.
Well, I feel so grateful that there are healthcare professionals like yourself that are, really on the ground helping people move forward with their lives and families, because that's really what it's all about. As a parent, I think anyone who's listening, our children are our Achilles heel. I mean, if they're suffering, we're suffering. If they're having trouble with something, we are having trouble with something. And so I'm so very grateful that you and other professionals that are out there are able to provide the support that so many families need and deserve. And it's really all about education, empowerment, so that people can, feel like they have some degree of control, because there's nothing worse than feeling like you have no control going on.
And that is
yourself.
Actually the number one contributor to feeling hopeless, is a sense of feeling out of control. And I think both of our work is all about teaching people that they do have control. I think for me, a lot of times people get to me, it's a layered, complex mental health problem. And we know through research that 50% of people who know they have a mental health problem don't actually get help. 50%. I mean, that's just unacceptable, right? And, why does that happen? I think people get caught in patterns, right? And they also have tried a lot and maybe it didn't work. And sometimes people try natural solutions and it didn't work, right? And there's lots of reasons why, because it could be that it wasn't done in the right order, right? So I deal with a lot of people with obsessive compulsive disorder, and just to understand what OCD is, it's intrusive thoughts that have rituals and around it. And many people confuse OCD with anxiety. Anxiety is a persistent worry. There's no rituals around it. But with OCD, those rituals have to occur more than an hour a day. And it can be unbelievably uncomfortable for people. People talk about OCD like it's this great thing, like I'm a little OCD because I'm so organized. No, that's not what OCD is, peeps. But, you can't separate out the clinical work, the behavioral work. And that's why sometimes people say, well, I tried magnesium, I tried inositol, I tried creatine. These are the things that didn't work for me. You have to use these resources as a way to calm and regulate your nervous system and brain. But then you have to actually change your behavior. They give you the wiggle room, right? So when we talk about the research with myo-inositol and inositol, particularly with depression, right? So there's great research studies like double-blind studies, meta-analyses. These are some good studies, and meta-analyses for people that are, Cynthia and I are research nerds, but it's, where they take a look at more than one study, several studies, and it's peer reviewed and they analyze the data. It's considered kind of like the highest level of research. What is cool about inositol in these studies is that there are some studies that show that the changes are lasting and there's no relapse. And in a lot of these studies, they used it with therapy, right? So if you're anxious and you take myo-inositol and your anxiety goes down, right? Awesome. But what little micro changes are you going to bring in your life, right? Are you going to hang out and talk to your sister every day who's so negative that makes you feel panicked every time you talk to her, right? Or are you going to say, I'm going to limit it and be like, hey, Catherine, I love you, but let's start every conversation with I'm grateful for. And let's see if she can do it. If not, make those conversations under 2 minutes.
For your own mental health benefit.
For your own mental health. But I think, so many, I use the analogy in our brain behavior reset program of the summit. everybody wants to just jump right to that summit, but you have to go to the base camps. And the magic in mental health is in the micro changes, right? And Cynthia and I are always talking about mental health from our own personal journeys, right? And it's those little changes that really, like, wow, create such dramatic positive feelings of well-being. And these tools can just be such a beautiful dovetail, right? The inositol lowering the stress levels, but then actually creating and cultivating change and being consistent about it. Nobody wants to be consistent. Like, when you think about intermittent fasting, people say, do I have to do it every day? Yes.
Well, I think so much of it is human nature that it's hard to be patient. We
Mhm.
want to wave a magic wand and we want things to be better. I
Girl.
know when I was writing, 30, 40, 50 prescriptions every day, I had patients that would look at me and they would say, I'm not going to change my diet. I'm not going to stop smoking. I'm not going to start exercising. I'm not going to go to bed earlier. So just write me the prescription. So we, in many ways, conditioned our patients to believe that the pill is going to be the way to get rid of whatever the symptom is, right?
Yeah.
And so what both you and I are speaking from is that it's far more nuanced and complicated than that.
Totally.
There is a degree of lifestyle changes that are going to be important in order to be able to successfully move beyond where you are. And one of the things I love about your work is also that you're very research-based. And so we kind of started the conversation initially talking about obsessive compulsive disorder and really understanding what that manifests of. And I'm just as guilty of saying over the years, I was an ER nurse. We had this is back when we did, we had paper charts before electronic medical records were a thing, but we were expected to document a certain way, same thing as a nurse practitioner, but done in an electronic medical record, very detail oriented. Being detail oriented is not the same as being OCD.
No, and Cynthia, but like we all, who hasn't said that, right?
Exactly.
Do you know what I mean? So it's just that I want people to know it's like, it is a very serious clinical condition. And until I changed my work and how I was treating people with the psychotherapy using exposure and response prevention, I just wasn't getting the same results just doing PEMF and neurofeedback and supplements. It's behavioral and it's scary to change your behaviors. Like it's scary, like as an adult, whenever I've changed my behaviors, which I'm always doing evolutionary, work, people shake out from you, like you have to. Cynthia and I are always talking about high vibrational levels, and the more you move up, people are either going to come with you and join you, or they're going to leave. And the leaving doesn't have to be a bad thing, but the idea of changing what you're doing when something feels really hard because you're depressed or anxious, of course it's going to feel hard. But I always challenge people to say it's about shifting. It's about shifting your efforts. Instead of working so hard, you are working smarter. You just have to give up the idea that there is the magic wand. And I always say you are the magic wand. It just means you have to make the little changes. And they're not, especially when you really try to get away from the negativity bias, Cynthia, I find that to be the biggest blocker of mental health, whether it's the individual for themselves, and absolutely 100%, it is the number one blocker of parents. They are like, well, I'm coming to you, Dr. Rowe, and we've tried the 6, ADD meds, and we did this and we did that, and I have no other choice, but I've got to come here. And I'm like, okay, well, you do have another choice. And, but guess what? We're only using evidence-based approaches, and we have to start with you, and you have to start seeing positive, speaking positively, because your brain is only going to believe what you tell it. So the moment you start being negative, which again, I didn't say this, but our brain is wired to see negative from evolutionary caveman processes. We see a negative in 1/4 of a second and a positive in 20 seconds. So you got to work harder. And that is, if you're a glass half empty, that's okay. because you could be a glass half full, right? It just is a little bit of a shift. And I encourage people to do it. It's quite dramatic when you really start implementing those little things, like no ifs, when, right? Whenever I say I'm trying, my husband always says, oh, I don't think Yoda would say that. Yoda would say, there's only do.
Yes.
True story. The Hodges love the Star Wars. But I think those are the important things that when we really want to take hold of our mental health, and if you're feeling really overwhelmed, it's just be there, be present in the day, and start with that one thing and lean into that one tiny thing. Like, just need one tiny little thing to open up the door and shift your mental health. You really do.
I think that's so important, the concept of the reframe. And I think for all of us, we have moments where maybe we're just having a bad day, we're tired. I know when I'm tired, I'm much less likely to be in that positive mindset. But it's important to talk about the fact that what wires together fires together. And so if you have negative, intrusive thoughts and you're struggling to kind of reframe or find, kind of a positive way of looking at something, everything is a lesson, as opposed to saying something's been done to me. No, actually, this has been a lesson that I'm going to then use to be able to move forward in my life. I think giving yourself grace is certainly very important. We're all a work in progress.
Yeah.
But I know for you and your work, because it is so kind of multi-purposeful, it's not just medications, it's all these lifestyle pieces. And you've kind of alluded to some of this. And obviously, selfishly, I'm directing the conversation because you're such a wealth of information. When a family comes to you and let's say they have a young adult or a teenager that is struggling with OCD or anxiety or depression as a starting point, obviously you don't start per se like right out of the gates unless someone is not stable, meaning they have to be hospitalized because there's something very acutely going on. But someone in an outpatient environment who's stable but kind of struggling, what are some of the things that you're talking about? You mentioned base camp. I would imagine base camp incorporates some pretty simple things as a starting point.
Yeah.
And what are those? Like, what are the things that you're starting with in your practice?
So number one, the base of my work is calming the brain. So if the brain is dysregulated, it's just so much harder to think, pay attention, and take action. We know this. This is evolutionary. And I'm seeing so many brains on fire. And so for everybody who knows my work and or who doesn't know my work, I should say, is I often do what's called a QEEG brain map, or if people can't fly in or drive to me, then I do something called a brain check. It's statistically looking at brainwave activity, and you can see what's overactive and underactive in the exact regions, as well as brain communication. It's the shizzle. I love it. It's great. Anybody who's ever done it is like, thinks I'm doing a tea leaf psychic reading. And it's because we know exactly what the brain does. So brains are dysregulated. They're on fire. You cannot live in a stress activated state. And a lot of the depression I see, Cynthia, is from hyper high stress levels that we ignore. And so what are the things that we have to do is, number one, we got to calm down that brain. So it doesn't matter what age you are. I'm going to look at, so I love my devices. I use PMF, I use neurofeedback, I use biofeedback. Everybody's got to move to an anti-inflammatory diet. Now, anti-inflammatory diet is the number one diet shown to reduce mental health. And there's a lot of anti-inflammatory diets, right? There's keto, there's intermittent fasting, there's Mediterranean. So I got to work with people where they're at. It's easier. Out of all the things I do, the dietary change is the hardest thing. I can convert a Catholic to Judaism easier. Because they just come in and say, I'm not changing my diet, right? So I'm soft and I get people to do buckets of change. Like, what are you willing to do? Are you willing to do a swap out? And then we just move through it. People are so stress activated, and then it's, what is the supplements? What does the brain need? And what does the clinical research say about each of these conditions? What is most helpful? So for me, whenever I have somebody with panic attacks, very high levels of anxiety and OCD, Myo-inositol is mandatory. And what I like to do is I like for them to use it twice a day. And what we know from clinical research, right? There's some research studies, in as little as 6 to 8 weeks, people can show some pretty significant changes. I have found that probably with OCD, and I do a lot of OCD with people with PANS and PANDAS. So there's an infection or toxin that's causing all this brain inflammation. It causes a misdirected immune response, and the body attacks itself, and it creates a lot of inflammation. So many of my people with OCD have PANS and PANDAS. So I got to say that. But what I have anecdotally have found with my clinical population, and please know I've worked with thousands of people. Like, I've been around a long time. This is year 31 for me. So what I have found is about 1/3 of people have a pretty dramatic symptom reduction within a short amount of time, even just a couple of weeks. About 1/3 of people show some significant symptom improvement over the first 2 to 3 months of me working with them. And about 1/3 don't, either they're not reporting it, or not connecting, or they're not actually experiencing symptom change. I still believe it becomes part of the protocol, and I don't have people remove it. I know that it's doing its work. What I'm looking for is overall symptom. But some of my people in that dramatic component are like, wow, if I don't take it that day, I notice something. So it's easy to make the connection. But a lot of times when you're so stressed, you're not always able to make the connection, and the people around you look for those differences in intensity, frequency, and duration of symptoms. But it really is very clear that diet, lifestyle changes, nutrient replacement, and really purposely trying to regulate your brain is essential for mental health. And that is really the foundation of my program.
It's really amazing. And I always love connecting with you and learning from you. And for the benefit of listeners, helping people understand that we have the autonomic nervous system. And so we have the parasympathetic and sympathetic, and we want balance. Our body's always looking for balance. And what Dr. Rowe is speaking to is that when our brain is inflamed and we're having these mood issues, it is a direct reflection in many circumstances of our brains being stuck in the sympathetic, we're being chased by a rabid animal, we're fleeing from danger. And one of the things that can happen, and we've seen so much of this during the last 3 years, especially with the pandemic happening, that people were so frightened, their cortisol was so high that their amygdala, which is their very primitive lizard type brain, is overriding our thinking, executive functioning part of our brain, the prefrontal cortex. And so this is when I will hear people saying things like, I'm so stressed, I can't think straight. And That's actually a physiologic thing that happens. And it's so important to understand this because, you think about the pandemic, or you get bad news, or there's a catastrophic accident, something happens, and it's happened to me in my lifetime. There've been specific times that I can recall exactly where I was when it happened. And just like sometimes you'll see animals that will just freeze, you don't even know what to do next, because you're not able to access that part of your brain that allows you to think like, what's the next thing to do? And so this is when you'll see people in many instances being very they can sometimes be belligerent. They can be difficult to speak to. They can, have trouble, making logical sense of what's going on around them. And it's a direct reflection of the fact that your body perceives you're under this persistent state of very high level stress. And cortisol is not a bad hormone. It gets a bad rap, but when our brain is flooded with cortisol, there's a lot of things that can break down in response to our bodies thinking we're under this, stress and duress. And in an acute situation, that's very normal, but chronically over time, it can really deplete the body. And I know that for many of us, we really focus in on, we call it somaticizing, but, someone has pain somewhere, someone has an infection, but equally important is what's going on in the brain. And so this is why your work is so important. And this is why I think on so many levels, when I kind of stumbled upon the research about the impact of myo-inositol in the brain, I found it so interesting because it works on communication between these neurotransmitters, things like dopamine and acetylcholine and GABA, which is this calming inhibitory neurotransmitter, and serotonin, as you kind of talked about. It also helps with brain signaling. So if you're someone that is struggling to make decisions and, that executive functioning in the brain isn't really optimized, in conjunction with other types of modalities that Dr. Rose talked about, myo-inositol in particular can be very helpful. And let me just back up and say, for anyone that's listening, if you are taking medications for depression, anxiety, OCD, you have an eating disorder, etc., do not stop any medications.
Absolutely not.
Yeah, we're not advocating that. I want to be the responsible clinician and make sure we put that disclaimer in there, but have a conversation because there's really very good research. I have a family member right now that's dealing with obsessive compulsive disorder, and this individual's in therapy. We're in therapy talking about it to be able to support this individual. And one of the things that I stumbled upon with my research was how beneficial myo-inositol can be, and how I've watched this individual's behaviors improve, less obsessive, intrusive thoughts, able to kind of go about their day. Of course, I'm not going to disclose who this individual is because I don't have their permission to do so. But what was interesting is when I was getting ready for our conversation today, the Journal of Clinical Psychopharmacology talked about a significant reduction with use of myo-inositol for 6 weeks in patients. There was another journal of psychiatric research that talked about the add-on treatment for OCD. So again, this is not a solo treatment. This is
That's right.
To other therapies, again, improvement in symptoms. And I think this is so encouraging because I think for so many of us, we're looking to be able to improve our quality of life. We're looking to be able to improve metrics related to quality of life. And I love knowing that there are things that are safe on the market that can be used in conjunction with other modalities that can be so helpful and beneficial.
Well, and you mentioned about the brain communication. So I love to talk about brain communication, but the research, so a lot of people the research has shown that with myo-inositol, when the improvement in cognitive function for people that are depressed, which I love to see, because one of the biggest complaints I get when somebody is depressed is truly not just that they can't think, it's shut down. And I think it's so important to talk about being shut down, because we talked about, as you so beautifully talked about, the autonomic nervous system. But we often think of an event that creates this. And you alluded to it's the daily, right? So why does somebody go into fight, flight, or freeze? So one of the biggest things I've actually seen in the pandemic is school refusal. So I've always had school refusal cases, but it's sort of the ultimate freeze. My body is so shut down, and this happens to adults too. And, when you're in fight, flight, or freeze, and it doesn't have to be one event, it could be multiple. And when you see this in a brain, it is exactly what you said. And when I do a QEEG, you see an overactivated limbic system. That's where the amygdala is. And then that's where your cortisol starts. So, you get a cortisol rush. Ooh, somebody almost ran over me. Okay, I'm okay. But this cortisol rush is happening for these people that are in fight, flight, or freeze. Your frontal lobes are supposed to put your brakes on. When I see a brain map, it's worn out. And there's actually a third area, the occipital region, is supposed to flood your brain when both of those systems are offline. And what I'm seeing is that it's worn out. And all three of these protective mechanisms in the brain that work together are not working. And guess what? Your psych meds aren't going to help you. You have to rebuild. And so things like myo-inositol, which is safe, right? You always want to check with your prescribing physician. But there's not known interactions, right? So you always want to get that okay. But, you can add this in along with magnesium's my fave supplement, but in the whole world, everybody should be taking it. And then look at what other things you can do for nutrition. For me, when anybody is this activated, protein and healthy fats become the number one priority. And most people are willing to do that part, Cynthia. They may not be willing to give up certain things, but they're willing to get in and add in clean forms of protein
and everybody likes some extra yummy, healthy fats. So, and that supports neurotransmitter. You have to look at the synergy, and then you can start taking actions, because once we get the fire down a little bit, we take you out of fight, flight, or freeze, you're actually going to be able to think and take action better, and you got to do it. Right? So what can you do to implement to make those changes? This is a great starting point for a lot of people. It's one of my favorite supplements. And it's also, a supplement that most people aren't talking about, which is so exciting that you are recommending this, because I don't have a preferred brand. I don't have things because it's not common. People just aren't using it. And it doesn't mean it's not good. It's just that we tend to go to the same things, right? So yes, I love magnesium. A lot of people are magnesium. You might be on the wrong one, right? Or I'm taking a B vitamin. You might be on the wrong one. Taking a D. Are you adding K? Right? So there's all these little pieces to help your brain health. And this is like a key one for any of these clinical conditions. And it's safe to get started and really to see a difference, not just in your activation, but in your thinking, which is where people need wiggle room.
Absolutely. And, it's really interesting over the past, 4 years of being your friend, I've learned so much about thinking outside the box about mental health and doing it in a way that honors our research-backed kind of training, but also allows us to think beyond kind of the conventional modalities as being, this is the only way to treat anxiety, depression, OCD. Now, you mentioned a little earlier before we started recording that there's some potential therapeutic benefit from for people with eating disorders, and specific to this, women with metabolic syndrome and binge eating disorders, which I thought was really interesting. And specifically to this, how many women in perimenopause and menopause will say to me, I started intermittent fasting, and then as soon as I broke my fast, I ate like 2 days worth of food. And so having that propensity, that, understanding what's going on in the brain, first of all, with binge eating, but knowing that myo-inositol can also be beneficial based on research, again, can be very beneficial for this, and how that can impact the way that we view binge eating disorders. I always think about eating disorders as, there's anorexia, there's bulimia, and then there's binge eating. And sometimes people have a mix of both. They could have just one in of itself. But have you been using this with some of your patients that kind of fall into those buckets as well?
Yeah. And I, eating disorders can creep up at different times for different reasons. And, they are much more prevalent in women, but they do exist in men. Sometimes we don't think of binge eating, which is so common, as a stress response, right? It could start out as an emotional eating, and then it really becomes an eating disorder when that's your way of coping, right? I also see, Cynthia, with eating disorders that are binge related, a lot of hormone issues. So women that are in our hormone age range, right? They may not have had any history of this and be stuck in a cycle. So you always want to look at what other things, what's the root cause, right? So is there a hormone relation? Is this emotional, right? I am actually not an emotional eater at all. Like when I get upset, I don't eat. And my mom passed away not too long ago, and I actually found myself, so we were very connected through food, right? Like Italian, my mother's like the classic, showed her love through food. And I found myself cooking a lot for my family and eating. And then I was like, oh my gosh, I've never done that. And you have to like sit back and look and then say, like, is that really the best choice? And then alter your behavior, right? So, it's always an evolutionary process. And I think for some people, this can really be an add-on. I also see for me in my clinical population, I have a lot of OCD eating disorder links. So I have a lot of people that develop intrusive thoughts around food, and sometimes it's contamination worries. And then they develop a secondary eating disorder, which then becomes a primary problem, because if you're really losing a lot of weight and you're not getting in nutrients, your brain is just not going to work, as well as it's a very high risk cardiac problem when you get below a certain weight. So there's a lot of reasons why people have mental health disorders. But when we really start to get into the weeds of how can we create change, right? So, this isn't going to have 100% recovery, but like I like to say to all my peeps, well, this might give me 5% or 10% or 15%. Then we do this and this gives me 3% and this gives me that. And the next thing you know, we have 50% symptom reduction, right? And you've had no symptom reduction. You have to start reframing and looking at what do I have control over? And you have control over a lot. And these conversations are incredibly powerful because nobody's talking about this stuff, right? And I'm so grateful that all the mostly women, but the individuals that are listening, because most women are the CEOs of all family mental and physical health. So this can really get very far and support not just you, but even your children as well.
Yeah. And I think that, kind of the traditional modalities. I know when I lived in Washington, D.C., almost always there were a couple of Facebook groups that I was in, and women were looking for therapists, psychologists, psychiatrists for their children, for their teens, for their young adults, and how challenging it was. And so I'm wondering if, and I don't know the statistics offhand, this just kind of occurred to me. Do you think that kind of the traditional modalities, I know when I was an ER nurse, unless you were verbally expressing that you wanted to harm yourself or someone else, you couldn't get hospitalized. And so I think the current medical model in many ways, until you are in an extreme, there aren't a lot of options. People wait weeks, months, very long periods of time to get in with professionals. Do you think it's a reflection of our current medical model? Do you think it's that people are working with less patients? What do you think is kind of exacerbating those circumstances?
Yeah, I think there's multiple things going on as I've been doing this for 3 decades. So one, it's the medical model influencing. So people think there really are only 2 options for mental health. They think it's a pill and the pill is a quick fix. And because that's what's presented to them, but they believe it as well, right? And then 2, there really is a dramatic increase. Like it's unbelievable, the increase. And also, I also see every day that people don't recognize the signs, the physical signs that either they themselves or their own child, right? So like, even with myself, I knew I was grieving and I was like, I did pretty well, and then, guess what? Your body keeps the score and your body will let you know, like, this is how you're acting. And really, when I looked back, I was tired, those are those kind of things. So we don't always see the signs because people with mental health overall, I would say the vast majority of people are functional, right? They're just not functioning well and they're not happy. And people it creeps up on you. It's not an overnight thing. And you sort of learn to accommodate and, be functional. And then until your body says, you've been in fight, flight, or freeze way too much. I'm just going to shut you down, and it happens. And these psychiatric admissions in hospitals, by the way, in the pandemic, just went on fire. Certain states declared a state of emergency, mental health. I mean, I knew most of my people never go to a psychiatric hospital. I mean, while they're working with me, because I have a lot of tools that are evidence-based. But I knew people that went before me, and there was one incident, more than one, I should say, where they were in the hallway in a bed. And many places you can't even get in. So it's multifaceted. We believe there's a quick fix when there's not. And we're not actually looking to research to what actually calms the brain. And by using these tools like Myo-inositol, PMF, magnesium, walking, gratitude journals, prayer, meditation, these things work. And they're really, really powerful. But ultimately, in the end, you must pair it with actual behavioral change. And a therapist can help you with that. But a lot of times, there are many more things that we can do on our own. And it's a culmination. There's no quick fix is ultimately in the end. But instead of feeling overwhelmed by that, I say, I've already said this, you need to be empowered by that. You have lots of ways to make your brain, whether it's your own or your child, be more regulated, be calmer,
I think that's so important. And the one thing that I think listeners have, I've been discovering the role of trauma and how that's played a role in my life and the way that I view the world, and, interacting with people like Dr. Gabor Mate, which for me was one of those podcasts. I don't know if listeners have listened to it. Was probably the most personal podcast I've ever done, not just on everyday wellness, but anywhere, just kind of sharing things about my background. But I wonder, for listeners that are listening to this, when we talk about the role of trauma and we talk about these modalities, understanding that what happens to us as children, we may think, little t trauma. I got teased, I got bullied. The boy down the street made fun of my teeth or made fun of my hair, or, girl bullying or whatever's going on. You got, emotional abuse, mental abuse, physical abuse. These things can crop up later and can be the impetus for a lot of these mood disorders that we are discussing today. And so I think it's helpful to kind of make that connection, because for many people, that's kind of a new connection, to understand that what's really at the basis for the anxiety, depression, potentially the OCD, the eating disorder could really be these unresolved traumas that we grew up in. And so I'd love to kind of end the conversation talking about that a little bit from a perspective that gives people options and really a reframe to understand that there's no one out there that doesn't have some degree of trauma, right?
Absolutely.
Trauma is just a wound. That's how Gabor Mate kind of describes it. Each one of us have experienced these things. It just is important, or the distinction should be made that can contribute to why people ultimately go on to develop some of these mood related issues.
Yeah, for sure. And you said it right. Who hasn't had a traumatic event, right? It's just understanding its impact to the nervous system, right? So we can't ignore something that happened. And, a lot of people have big traumas. I mean, I always talk about my dad's trauma. My dad is my dad and I are like a lot alike, right? And he's really fun. And I always say, when I go out locally, nobody knows me as Dr. Roseann. I'm only Tony's daughter. And they're like, "Oh, I love your dad." It's usually some Italian girl. It doesn't matter where I am, the bank, anybody. I'm only Tony's daughter. And he's very beloved. But, he had a horrible, horrible, traumatic childhood, and I should make a Lifetime movie out of it. And I love to write, and it's really an unbelievable story. But ultimately, his father was prisoner of war for the first 8 years of his life, and his mother beat the crap out of him in his sleep when he did normal stuff. He is the most happy man, and he has like unconditional acceptance and love for his mother. And when stuff comes up, we can have a conversation about it. But, that's a clear-cut case of trauma. But, your child, one of my most traumatic events was my son getting his tonsils and adenoids out. It was a horrible, horrible experience. And really, we knew something was wrong with him. And it turned out it was Lyme disease. And it just opened up into this world of PANS, and it was a nightmare. And it was bad. It was bad on a lot of levels. But nobody might not think that. They're like, "Well, you weren't beaten, you were clothed, you were clothed and fed and all that." Doesn't matter. If something is an unresolved issue in your nervous system, it's going to show up. And what's interesting that I noticed, Cynthia, about menopausal and perimenopausal women is that, especially when you're high level and you've been functioning and the hormones go down, some of these traumas, some of these injuries, actual physical injuries to the brain, you aren't able to keep it together in the same way. And things flood your nervous system, and you may have an activation, as well as some of the developmental milestones of your children may be bringing up some of these traumatic experiences. So we can't ignore it. Sometimes people will say to me, "Well, I have to just let it run in the back of my head." No, you don't. You don't have to let it run in your back of your head. I help people all the time. I was one of 9 approved providers at Sandy Hook. I've done a lot of work with 9/11 survivors and had the privilege of supporting a lot of other people with big T's too, and little T's over the years. And I think that acknowledging it is the first step, But if you start to really see how this plays into your day-to-day, is this where your negativity bias comes from? Is this how you speak to your child? Does this create fears that hold you back? Well, these are all things that can be explored, certainly in psychotherapy. And you've got to regulate the nervous system and then find a way to healthily put away your trauma in its closet, whether that's EFT tapping, somatic work, EMDR. There are lots of types of very trauma-specific therapy that really can help you to process it without reliving it. And many people with trauma get stuck in a reliving kind of state, and it doesn't have to be that way. So I hope that's helpful, because I think trauma is so much more prevalent, big and little T's, than we realize, and what a disruptor it is to your nervous system. And if you're working with someone and you're not getting somewhere, that trauma may have more of an impact, and you might have to do a deeper level of work. And I don't want people to be, I recently worked with, she's the coolest lady. But she had such a horrible trauma abuse background, massive physical abuse. She's very successful in her industry. She's one of top 4 people in the world in her job. Okay. I can't say what it is because it's an obscure job. And so she's been seeing her psychotherapist since 1998. Okay. 1998, people. So she comes here and we do neurofeedback. And she's like, I didn't even know it was possible to not have trauma activation. And now we realize she has executive functioning challenges. So we're supporting her in her executive functioning, but she just doesn't have the activation anymore. And the activation was really disrupting on so many levels: moodiness, anxiety. As high level as she was at work, they accepted her abrasiveness with others because she was gifted at what she did, but she had constant conflict with people. She chose not to have children. She chose, and for her and her path, she made a lot of choices because of a trauma that she couldn't get under control. Once she's been able to get that under control, her life is so dramatically different. So no matter what has happened, there's always a path. And I don't believe that somebody can't get better. As long as you want to believe in it and you make those changes, actionable small steps is really what creates these massive waves in our nervous system.
Well, and it's interesting. Our mutual friend, Dr. Joan Rosenberg, always says, if you have the capacity to think, you have the capacity to change. Thank you for the amazing work that you do, my friend. Thank you for carving time out of your busy schedule to come on the podcast, to be able to speak to all of these tools and strategies that people can use to support better mental health.
Well, thank you for being here. I could talk to you all day. So, and wherever people are in their journey, you just have to take one small step. That's my biggest takeaway in all of this. And if that is starting with myo-inositol, then do it. It's safe and it's worth a try. And you just have to be consistent with it. That is one of my biggest takeaways. Those small actions of consistency is really where you create mental wellness.
Absolutely. Please let my listeners know how to connect with you, how to find your book, how to find your work, and your new podcast.
Yeah. So you can go to www.drroseann.com, and you can go to /podcast. And if you're a parent looking for more tools and support, in all of my work, it's there, but my podcast it's going to be okay. And we talk about all this stuff all the time. And it's been a pleasure and a privilege to be able to share that information, because man, people need a lifeline.
They absolutely do. Thanks again. Hey, if you like this video, you guys are going to love this video, and I'll see you there.
If you have either uncontrolled diabetes, and this goes for type 1, type 2, LADA, MODY, any form of diabetes, if you follow the standard, if you follow no advice, you're probably going to hasten your death even more than 3.5 years for each decade you have it. But if you follow the standard advice, the state-of-the-art advice, the scientific consensus advice, then yeah, you're probably going to be knocking 3.5 years off your life for every decade that you follow the American Diabetes Association recommendations.